look forward to having more professional association. I look forward to the hygienists coming together and saying we can do something here. I look forward to the trainers sitting down and saying we can do something here. I look forward to the plant examiners saying we can do something here. So that we can all progress. The doctors saying we can do something here. I really do look forward to having bigger and bigger events where we are going to have thematic breakout groups and more engagement. The organizing committee. I think sometimes we see events happening and we do not appreciate how much work goes towards making the event happen. And I would just like us to just start where they are, the members of the organizing committee. And I'd like us to give them a special hand clap. Has worked tirelessly since last year in conceptualizing this event and bringing it alive. And I would like to appreciate that. So having said those few words, I would like to welcome you to once again at this national conference. I think it's a conference where we look forward to shedding more light and causing less heat, so that we leave here when we are more enlightened and more inspired and more alive to the place that we have to improve safety and health. Many times we feel like the man who is hitting against a boulder, and you're wondering whether you're making any impact on the boulder. But we know that eventually the boulder cracks and it crumbles. And it is not the last blow that crumbles. Every single blow from the beginning had a part to play in making the boulder break. So I want to believe that we are what I would think of habitats for safety and health. And we are looking at safety and health and the need to entrench it across our economies. Whether we are talking about the micro and small enterprises, whether we are talking about energy sectors, whether we are talking about our learning facilities, wherever it is we want people to be alive to the fact that safety and health is key towards ensuring a more productive workforce and key towards our sustainable development goals. And they are key towards the insurance of a healthy environment. It's a key pillar towards ensuring a healthy population and a healthy environment. So I look forward to hearing the conversations. I want us to not just listen, but be provoked enough to act, and be provoked enough to think, be provoked enough to always go forward. So I want to stop there and invite back the MC and declare this conference officially open.
Thank you very much. Another hearty clap for our Secretary. I want to recognize the presence of those presenters whose names we might have forgotten. I want to invite our first presentation. It's a presentation by a gentleman called Mike. Winnie, I want you to project Mike's presentation. Mike, as he comes to the front, we have agreed that we will have timed presentations. In collaboration, as it has been well stated, Kengen have really supported this discourse. They have created an online link that we can share with those of us who are not in the room. There is a link that can be shared among ourselves. The link is a Zoom link. You could share with your colleagues from wherever they are, and they can participate in this workshop. I want to give Mike and company to briefly introduce themselves and still do the 10 minutes, 15 minutes.
very much. Good morning, everyone. My name is Mike Chege, and I work for Kengen PLC. Today we have a paper authored with my colleague, James Kitonga. So he will take the better part of the presentation, but I'll be here to give the support. Thank you.
So, good morning. Okay, I'm James Kitonga. You can put the next slide. Yeah, so we'll be taking a paper entitled The Future Response by integrating EV in the fire response and also enhancing safety and security in our job. Okay, this is our title, Future Response by integrating EVs for safe emergency response and reduction of psychosocial. Standing EV stands for Unmanned Radio Vehicles Integration during the emergency response, focusing on the theme for this year, which is fostering good psychosocial working environment. This is being presented by Mike and I. So in terms of our roadmap, this is what we'll be covering, the background, what is the UAVs, the problem statement, the research objectives, the literature review, the conceptual framework, the methodology, resource analysis, and then we do the conclusions and recommendations. So I pose you a question. What if the first responder and prior will be assisted emergency? Look the life of a fire marshal. When the cause comes, the pressure it goes, the stress it undergoes, the timeline, the austerity from the community, the expectation. So this has always been a challenge. So now we want to help to give him an helping hand, an intelligent tool that will be able to support him so that before he arrives at the scene of the fire, that tool will have given him a situation awareness, that tool will have given him the aerial mapping, it will have done with the normal cameras, and by the end of the event, it will be back. So in the normal scenarios, the fire marshals, they assess the risk on site. This gives them an higher exposure time, and sometimes due to the pressure, they make bad decisions. But now with the combination of the two, they will be able an area assessment remotely, which will also be able to reduce the exposure time and inform. So we are not eliminating the fire responders, we are integrating them. So they want them to work in two so that we can perfect this area. So for this, it will lead to better information, which will be able to reduce risk and stress. So currently, this is our traditional, the current approach. We have the human enters the risk, then we are able to identify, we have high exposure times, right decisions. However, with the AV now, we'll be able to do the integrated, we'll be able to understand what is happening before, we'll have informed safety, then we'll be proactive. So the current scenario, you enter, you understand later. But now, when you integrate the both, you'll be having understand first and then enter together. In simple terms, is a drone. You'll be addressing the drone to work. This, especially when normally we have been having a challenge, especially for ice scrappers buildings, former settlements where our machine cannot enter. The capacity of a fire engine is about 10,000 liters, and most of the time we have watched from the news, maybe hakuna maji. So we serve and then we can do. So a drone can clear the fire with only 6 minutes. So that's why I want to integrate both technology and the human. We have delayed access and high fire this by the week EV integration. This is also empowered by standardized protocols, which now resource to through a process. Sometimes when the building can collapse. So this can result to crash injuries and entrapment, and also you can have some falling because of the normal. These are the invisible dangers which are never seen. First, when they come to the scene that is that anxiety, they make decision without the situationalness, which now complicates. That is that cognitive of the cognitive that they achieve. And then we forget they live with the traumatic attacks. They lose their colleagues. The people are dead. So at the end of the day, after the event is done, they are traumatized. In God news, got a fire, and from the time 01, we were able to issue a fire notification. So we got some response from Nairobi and Kajiado County. This took about which was a hydrodynamic fire. So the gearbox started having fire. So by 60 minutes, we have now the first fire engine alive. However, now we had a challenge. That fire could not ascend because the height of the wind turbine is about 67 meters. So we had to watch the fire to decay. So the challenges was now incomplete situation awareness. There was no aid, and also the total time was about 3. So it brought a lot of stuff because the brain would fall and close some arms. So this is what we triggered us to have this idea. So my research objectives, so I proposed the next 5 years, which is the year 2021. In Kenya 1, we should ensure that all hazard exposure reduction has been done. 2, we reduce the psychosocial impact on emergency responders, especially which is around to ISO 45003. We also need to avoid the situational among the responders by evaluating the UAV-driven equipment to responders. And finally, we propose that we reduce the processing of the mental, which is reduced cognitive load, by having a link that will be able to integrate between the UAVs and our firefighters. So for the sake of the research, this was my hypothesis. I took alternative hypothesis because at least I did not want to know the real answer. So my first hypothesis was the hazard reduce the exposure among the fire and safety. 2, my second hypothesis was the situational awareness, where the UAV used critically to improve the situational awareness during especially for the ERT members. I was supposed to be able to use the situational awareness global assessment technique, where I was to measure the level 1, the perception of the environment, level 2, the compression situation, and level 3, the projection of the future. And the Richter scale, and this is what we wanted to use. So in terms of data analysis, our awareness increased by 70, and stress was reduced by 39 after the study. So interpretation, what the data tells us, using UAVs transforms emergency response to reactive and reduces the uncertainty, the pressure of the fire marshals, and the fear of the unknown. Also, it will lower the cognitive overload in terms of having prior information of the fire. And then it will enhance now better coordination in terms of shared awareness through the live feeds and the quality of the communication. So from the validity, I learned some strength and weakness, the limitations or incidents. Then this data was self-reported, so there was a bias risk, which now I do not handle. Then the sample size was only limited to Kenyan employees, especially the emergency response decisions in terms of the employees, strong organizations, and African decisions. So my conclusion, this study will help enhance safety. It will also enhance the Kenyan Aviation Authority to get the rules and governance. We need to support the psychosocial integration. And also I urge you now, Sidney and Chris, you can do future research by embracing references. These are the references I was able to use. And these are the appendix I was able to attach to the paper. And I review with this. The future of the fire response is safe, smarter, and more human.
They are talking of UAV. One of my colleagues was asking me what is UAV. It is an unmanned aerial vehicle, what we call a drone. Thank you very much for opening our session. In that regard, I want to request those who are at the back to come fill in the seats so that we do not have a lot of movement coming forward. The last three. You're not even listening, just stand up. Say I do the last 3. As you stand, kindly come forward. Stand and kindly come forward. Ujeni tu mbele, engineer, Kanjuki. Ujeni mbele so that we fill in the seats at the front. With that opening session, now at least we brought our minds to the conference. I want to recognize the presence of NACOSH members who come in, and the presence of a very important speaker for today. The keynote speaker for today is already on site, and we would want to give her the chance to speak to us. Dr. Florence is the head of psychiatry at MTRH, so she's opening the space that we should be looking at throughout today. I want to kindly welcome you, talk to us, tell us about psychosocial hazards, or whatever it is that you prepared for us. Welcome.
Secretary OSH, representative of NACOSH, social partners FKE, country representatives, safety professionals, karibuni sana. It's a privilege to join you here to the workplace. Those things are the workplace. Those things are consequential and they cannot and diabetes and all these other physical things that impact on the workplace. All right? If we are to ensure workplaces that are productive risks as well. The workplace in Kenya is rapidly evolving. We are seeing expansion in the sectors such as manufacturing. If you look at education, it's rapidly evolving. If you look at healthcare, it's rapidly evolving. That's the sector where I work. The policy changes are rapidly shifting. The transport sector as well, the informal sector, it's rapidly changing. And with these changes come new pressures, increases in workloads, people have to adjust, there's a lot of economic uncertainty, and that significantly contributes to chronic stress and anxiety, and people turn to substance use and other harmful coping challenges. So to illustrate this burden of psychosocial issues in the workplace, studies have been done in the healthcare sector, for example, that show that about 30% of healthcare workers struggle with depression, about 95% face burnout, and about 40% harmful alcohol use. Okay? We need to do more research in other sectors. A lot of what has been done in the healthcare setting. But what we can see is that there is a high burden of psychosocial challenges in the workplace. NACADA did a study that showed that about 56% of civil servants were taking alcohol. So we are really a drinking nation. So despite this reality of mental health issues and psychosocial challenges being a major problem in the workplace, is stigma. We are not talking about it, we are keeping quiet, okay? And many people continue to struggle in how problem alcohol use looks like, okay? And so as we keep quiet about it, as we don't know how to recognize it, also productivity declines and workplaces and organizations continue to bear the brunt. So this has an impact on the output of organizations as well. So the cost is there for the individual employee, for the organization, but also for the economy of the country. And so what ILO has done this year is commendable, and they are asking us to shift, from thinking about these physical injuries to focusing on psychosocial well-being, and to say we have to begin to address mental health and psychosocial issues in the workplace. And it can be done, okay? And I'm glad I was looking at the program and I was seeing examples of organizations that are here that have been able to implement their own wellness organizations, programs. It can be done. First of all, we need a leadership that is committed, and a leadership that wants to, that puts in place an organizational culture that supports psychosocial wellness. When leaders prioritize mental health and psychosocial wellness and allocate resources to it, they send a very strong and powerful message that psychosocial well-being matters. Institutions need to integrate occupational safety policies, just like is done for physical hazards. The culture also matters. The leadership of organizations should promote fairness in the workplace, as well as respect for employees. Employee roles should have clarity, and roles should align with competencies. All these things, form a culture that supports psychosocial wellness. Employees' performances should be rewarded in a timely and equitable manner, and practices in organizations should not be discriminatory and should be supportive. And the work schedules as well should be structured to support work. You can see, but then the signs of stress are different. You can see, but then the signs of stress are different, and we don't yet know very well how to recognize them. And workers need to be trained and supervisors as well. Training in stress management is needed as well. That is key. And psychological is needed as well. That is key. And psychological first aid. And those simple things can make a difference. And this intervention should be tailored to the different, workforces across the various sectors that we work in, both for one and for all. We must invest in accessible support systems in the workplace. So, as much as we put in place systems, facilities for delivery of the services that we deliver. So, for example, I work in a health setting, and we have the wards and the equipment, the MRIs, and all of those things that support our patients. But we have learned here that we also need facilities that support the worker. Because if I'm not well, I cannot take care of my patient, and I believe it's the same thing for your sector as well. If a teacher is not well mentally, then they cannot teach the students. So we have to think about workplaces that meet the psychosocial needs of the worker as well. The safety and the wellness of the worker and the staff is as important as the facilities for the services that they deliver. Okay? So interventions like employee assistance programs are important, peer support networks are important, and linkages to appropriate mental health services are extremely important as well. We need to strengthen policy and compliance. We have made important strides in having occupational safety and health policies in place and legislation. However, integrating them into the different institutions that we work in, implementation and enforcement is still a challenge. And I hope that in the course of this conference, we'll talk about how we can better integrate them into the different institutions that we work in. For example, we talked about having psychosocial risks integrated into our risk management frameworks in the institutions that we work in. Okay, realizing that it's a core risk, that can interfere with operations in our institution. If you look at our Work Injury Benefits Act in the country, it has significant gaps. There is no room for compensation for psychosocial harm. Okay, I work in a rehab, the alcohol and drug abuse unit, and the mental health unit of my hospital. My examples are really from the health sector because that is where I work. And many times we experience psychosocial harm, but how are we compensated for the consistent emotional stress and strain that we expose ourselves? Interventions, employees become more efficient and more productive. There's less absenteeism. There's more output from the employees. So that is better return on investment as well. To get a more resilient workforce and a more competitive economy. As I reflect on the theme of this year, I'm reminded of my own personal experience, having worked in the employee wellness space in my institution for close to 8 years. I have seen how psychosocial and mental health challenges are very prevalent among employees, such as alcohol issues and drug abuse issues, how things that happen outside, like family conflicts, spill over into the workplace, how burnout and heavy workloads affect employees, how it affects staff productivity, and how it is the responsibility and it is the business of the institution to support the psychosocial well-being of staff. They cannot detach themselves from it. They have a responsibility to support staff wellness. In my institution, Moi Teaching and Referral Hospital, we have put in place a strong employee assistance program for over 10 years, overseen by a committee and supported by a strong policy, as well as a budget that is allocated annually. We have several interventions, including staff education, peer support, a weekly mental health clinic dedicated to staff, as well as regular staff debriefing, among others. Implementation of the intervention is integrated into the institutional performance contract, and so staff across the hospital are mandated to participate in it. I'm excited about this conference because it brings together stakeholders from diverse sectors, government, private industry, healthcare, academia, and civil society, and this diversity is a strength. Over the course of this conference, therefore, I urge us to share evidence, learn from best practices, and identify practical steps that we can implement in our various organizations and sectors. In closing, the future work in Kenya depends not only in innovation and economic growth, but also in environment support the wealth of staff, so that we can build strong organizations and more resilient and healthier communities. Thank you, and I'd like to ask my employee assistance program committee members to stand and wave because they do an excellent job in supporting staff wellness. If you hear the two of you, Jackie and Joshua, Jackie, all right, asante.
Thank you very much, Dr. Florence. Let us give a more hearty clap. He has spoken to us very well about the actual practice, rather than the theory. He's talked to us about what she deals with on a day-to-day basis. Unfortunately, most of us are only thinking of workers, forgetting that we are also workers. So whatever Natali was telling you is what she's likely to tell you when you go there. And you do not know who is going there next. The workers are the ones who go to her. And we are also workers. When she talks about the problems in the workplace, the patients who go to hospital, we experience them on a day-to-day basis. Thank you very much again, Dr. Florence, for agreeing at short notice to be our keynote speaker. And we are much, much grateful. The next session, we will have Esther Mutuku. Esther Mutuku is an occupational safety and health officer, a professional, a young budding professional working in Nyeri. We want to welcome her to present to us in the next session. As she prepares, I want to invite to inform Vivian to kindly arrange for the next session, the panel discussion, we should be following next. Esther, moving forward. Let us give her a hearty clap as she comes to the front. She's barely 2 years old in the department, so that's how strong this lady is. She's a big brainer. She will take us through psychosocial health issues, but I will also allow her 1 minute to introduce herself and what she does in DOSHS. Thank you, Esther.
Good morning, everyone. My name is Esther Mutuku, occupational safety and health officer from DOSHS. It's a pleasure to be here. A little bit nervous. We are talking about psychosocial hazards. but I'm glad. Quite an enthusiast of mental health. The works of the brain always reduce it. So today's presentation for me today, it will be a brief explanation in a project that DOSHS is still working on, a code of practice for psychosocial hazard management in this world of work. So it's something we are proud of and we really appreciate an effort which has concurrently occurred during this year. Our theme being psychosocial hazard management. So for my title, we started Beyond Hearts, protecting the minds at work through psychosocial hazard management. The heart there is symbolic in a way. We majorly focus on physical management of hazards. Under the helmet have the brain where we majorly talk of the psychosocial aspect of it. It is a hidden disaster. Time-ticking bomb, if not well handled, quickly interferes with productivity in work and everything. For the brief introduction, psychosocial hazards are increasingly recognized as emerging risks in modern workplaces, driven by changing work environment, job demands, and organizational structures. These hazards significantly affect employees' mental health, productivity, job satisfaction, and overall well-being, often leading to stress, burnout, and reduced performance. We can all agree there is a growing global concern, with countries like Kenya acknowledging the need to address psychosocial risks as a part of occupational safety. This highlighted the urgent need for the structured guidance for a code of practice to support organizations in identifying, assessing, and managing psychosocial hazards effectively. For the background, we can tell mental health is an integral component in occupational safety and health, yet it remains inadequately addressed in many workplaces. The effect of ill mental health at workplaces translates to a high economic burden, leading to loss of productivity, stigma, and discrimination, and increased risk further common to mental disorders. Mental disorders are aggravated by the stress in workplaces. This underscores the growing need for deliberate workplace intervention to promote psychosocial well-being and safeguard employee health. So for the problem statement that led us to the actualization of this code of practice, psychosocial hazards remain poorly managed across all many workplaces, often receiving less attention than the physical safety risk. There is a lack of structural guidance, the various policies, a standardized approach, resulting in inconsistent management of those hazards. Low awareness and significant implementation gaps further limit the effectiveness of existing workplace interventions. As a result, organizations experience reduced productivity, increased absenteeism, and a compromised employee well-being. So for the research gap that led us to creation of this code of practice, there was limited national guidelines on psychosocial hazards. Existing OSH framework more focused on physical hazards, weak integration of mental health into workplaces system. There is insufficient data and structured risk assessment approach. The justification for the development of this code of practice, there is a critical need to protect workers' mental health as an essential component in occupational safety and overall well-being. Addressing psychosocial hazards will enhance workplace productivity, efficiency, and organizational performance. This initiative supports alignment with international best practices and standards, including those of WHO and the ILO International Labour Organization. It provides a framework to strengthen policy development, regulatory compliance, and enforcement mechanism in workplaces. ultimately, it contributes to the promotion of a decent work and sustainable employment practices in Kenya. The whole objective for the creation of the Code of Practice, we had a general objective of developing a comprehensive code of practice for the management of psychosocial hazards in the workplace, in the whole concept of the world of work, including the economy, online. The specific objective that led us to the creation of the Code of Practice was to identify psychosocial hazards in workplace. After identifying, we can establish a risk assessment process, provide prevention and control measures, and to define roles and the responsibility of different parties involved in the workplace, to promote mental health being to work. The scope applied to all workplaces in Kenya, which covered the public and private sectors, the formal and informal sectors, the emerging work arrangement. We have to agree that different work arrangements are upcoming. We have the remote works, the gig economy works, which was also included in the guidelines for the creation of the Code of Practice. It will include all employers, employees, and also the regulators. For the literature review, this was a secondary literature review where we used the existing policies and establishments that were curated earlier. So for the literature review focused on the workplace mental health, psychosocial risk management, guided by the evidence-based approach drawing from both international and national frameworks. Globally, the World Health Organization and the International Labour Organization emphasize mental health at work, linking psychosocial hazards to stress, such as burnout and depression, and promoting preventive approaches to them. In Kenya, the Occupational Safety and Health Act 2012 and the Mental Health Act 2022 recognize and support workplace mental health. However, the gap in implementation, enforcement, and awareness continue to limit in effectiveness for the management of those psychosocial hazards. Theoretical framework, we did a risk management study where it treats psychosocial hazards and risks that should be identified, assessed, and controlled to prevent harm and improve workplace performance. The hierarchy of control models prioritizes control from elimination, which is always the first, to PPE, and focusing mainly on redesigning work and improving systems rather than individual coping. The system approach theory to occupational safety views the workplace as an integral system where organization, human, and environmental factors jointly influence psychosocial risk and safety outcomes. A key diagram explaining the theoretical framework that was used during the creation of this Code of Practice. Where we did the system approach, psychosocial hazard management, where we used the risk management theory, the hierarchy of control models to come with the outcomes, and key guidance system to guide us in managing the psychosocial risks. So for the research methodology, a structured practical methodology and policy-based approach was adopted and focused on understanding psychosocial hazards in the workplace. It involved reviewing relevant laws and policies to assess existing law and regulatory framework. It also examined the international guidelines and existing literature to identify global best practices and evidence-based intervention. In addition, stakeholders consultations were conducted to capture insights from key actors on workplace experiences, challenges, and implementation gaps. The code was also able to go through a public participation mode where we got some feedbacks that help us enhance the Code of Practice. For the data collection method that we use, different analysis was used, stakeholders engagement, expert input, and cooperative policy review. Key components of the Code of Practice. Each component has been fully explained further in the code of practice. It involved the legal frameworks that were used, the duty of care of each party, the risk assessment, the preventive and control measures, the incident management and monitoring and evaluation. So for the results of the code of practice, it had hazard identification methods, where different 10 categories of hazard identification were stated. Common hazards identified were work stress, harassment and bullying, job insecurity, work-life balance, multiple identification methods. We did a risk assessment where a structured risk assessment analysis process was used. We used a risk rating score which had a likelihood, severity, and risk scoring system. For the control measures, we used the hierarchy of controls, which included elimination, substitution, engineering controls, administrative controls, and individual support. Inclusion of support systems, which included the employer assistance programs, counseling services, workplace accommodation, training, and awareness. So for the current discussion, we can all agree and say psychosocial hazards are increasingly being reported across different workplaces, reflecting on growing exposure to work-related stressors. However, many workplaces remain underprepared in terms of system, resources, and structured interventions to effectively manage those risks. Cultural stigma around mental health continues to limit reporting, help seeking, and open discussions among workers. There is therefore a clear need for stronger leadership commitment and consistent enforcement of policies to ensure effective psychosocial risk management. Challenges identified during the making of this code of practice, there was limited awareness of psychosocial hazard, which reduced the ability of both employers and workers to recognize and address work-related stress. Resource constraint, lack of trained personnel, and weak monitoring systems further hinder the effective implementation, supervision, and evaluation of psychosocial risk management strategies in the workplace. Recommendations that we came up with was to strengthen awareness in the training programs, to improve understanding of psychosocial hazards among employers, managers, and workers, psychosocial risk management in the existing DOSHS system to ensure it's treated as a core workplace safety issue, improve reporting mechanisms, encourage early identification, confidential reporting, and timely response to psychosocial risks. Enhance enforcement of existing policies to comply and accountability to all organizational levels. Provide a simplified practical tool, guidance to support small and medium enterprises in implementing psychosocial risk management effectively. In conclusion, psychosocial hazard remains a critical emerging workplace risks that significantly affects workers' well-being and organizational performance. This will provide a structured framework for identifying, assessing, and managing those risks in a systematic way. It will promote the development of a safe, healthy, and productive workplace through perspective and participatory approaches. It's going to be a game changer for psychosocial hazard management. But we have to keep a key thing in mind.
We have a number of panelists who are coming in for this session. One of them is our very own Madam Irene Karanja, who will be one of the panelists. Kindly come forward. We have a representative of WASPAC, is Sylvia Kamau. Is Sylvia Kamau in the house? Sylvia Kamau. Thank you very much. Come forward. Joshua, bring the chairs, please. Chairs. the industry, Madam Rebecca Wanyoni. I don't know whether she's in the house. Madam Rebecca, if you're in the house, kindly come to the front. Welcome.
Good morning, everyone. So we have a panel that is drawn from government, industry, as I've mentioned, professional associations. They'll have an opportunity to introduce themselves, and then we'll jump straight into today's discussion. So I'm left-handed, so I have to check. We'll start from this side, my left. And I'll pass over the mic, sorry, we only have one.
Good morning. I'm Rebecca. I'm a counseling psychologist. I'm happy to be here.
Good morning, everyone. I'm Irene Karanja, Director in charge of Occupational Safety and Health Administration at DOSHS.
Morning, my name is Alan Stevens. I'm Strategic Advisor to Westpac, as well as governments and corporations throughout the world where I help them deliver their strategies. So, thank you.
Good morning. My name is Sylvia Kamal. I work with IBM Global Safety, where we ensure that IBM's holistic safety management program and ISO is on check here today.
Thank you very much. So you had a brief background of our panelists. Core question, as a reminder to everyone who's watching, is we're trying to look at technology is advancing, but how can we as a collective ensure that that is happening? It does not undermine psychosocial well-being, but rather supports it. So we'll start with our government representative. In the last presentation here, I think by Esther, she really alluded to us already having a code of practice, and I know if you read our policies and regulatory framework, you understand that we have systems in place already. Now, Irene, from your understanding, are there any gaps that continue to exist when it comes to the legal framework? What do you think?
Of course, starting from the fact that when it comes to technology, it seems like it's facing us in the world of DOSHS practice. We're actually chasing technology. Yeah. We find a lot has happened, and all the conflicts that come from use of technology, they are not taken care of by our legislation. Number one, for example, Education Safety and Health Act is only a very generic clause that talks about employers keeping the workers safe and making sure that the work environment is safe for everyone. our officers, the OSH officers, and the auditors and all other OSH practitioners actually use these clauses and try and see if they can bring in issues of psychosocial risks in the workplace, especially those brought about by technology, how it can fit within this framework. If you look at the national OSH policy again, the 20 version had practically nothing that we can talk about. The 2024 draft, which seems like we are already implementing even before it launched or approved, has something little, but would like to see more. And this obviously was the basis of trying to see if we can bring out what Esther Mtuku was talking about, the code of practice on psychosocial management. But at the same time, when we look at issues of, take for example, I'll just give you a few examples of where technology has really taken us back when it comes to trying to see what we can do about this in workplaces. I will start with something. 1983, I think, those, I don't know how many were not born in 1983. There was a song by a group called Rockwell called What Is Watching Me. Yeah? That time, in Kenya, I believe there was practically no technology advancement as we could have imagined whenever they were playing this song then. Remember, those were the days when a song is sung in the US. It took how many months to get to Kenya? Yeah, that's how technology was. But then now, you look around, everybody, what? Is there someone watching me? What? In whatever I'm doing? What is it doing to our minds? Those who already we know this, if you are in substance abuse, this could be very common. But then now, this is now everybody's wondering, is there some webcam somewhere? Is there some CCTV doing something somewhere? And all this. And at the same time, you have to work. So we understand there are even probably some employees in this room right now who have an issue when it comes to when they are typing on their laptops. They are wondering if somebody is checking out what it is that they are typing. You know, these things bring about a lot of psychosocial unease. And what we can do as government, what I believe we should do as government, number one, we must collaborate with others because technology, ICT, is under the Ministry of ICT. They are coming up with these innovation hubs where anybody with a nice innovation is welcome. Probably they even go to Sylvia's place for capacity building and the like, and then they come out here. But do we check the safety and health issues that these innovations, because these are things that we need to talk about. So we obviously need to start speaking a little bit more frequently, bringing when it comes to technology. That is one area. The other one obviously is, as I said, the of technology in our world makes us think that we need to increase the regulatory framework, make it tighter. Regulation is not helpful, but we can come up with guidelines. One of the last slides, Esther Mtuku's whatever, where she was talking about recommendations, you could see there what we can do with the guidelines, and when our officers go for inspections, they can have some tools, so that they use them to check on. And I don't know if the auditors actually bring out an issue in their audit reports on psychosocial matters in the workplace. Of course, as we go on today, there are some areas that are explicit that an auditor must report in the audit report something about the psychosocial.
Yes, we're back. So Irene has touched on the OSH Act, touching a bit on the issue we're discussing here today. But of course, there's also the code of practice. The Ministry of IT also has several guidelines out, a good idea to read. The OSH policy, the 2024 draft, touches on the new forms of work as they continue. Maybe we can read on those. Now, let's go to our representative for OSH Association. Alan, building off of what Irene shared with us, the legal framework that exists, what do you think we can do as we continue to try and integrate these new forms of technology as they emerge in the world of work?
I'll get the hang of this one day. Thanks again. I'd like to provide some context of what we see happening across the world and why this is important, because to implement what Irene is talking about and the OSH professionals in the room need to implement, you have to understand the wider system. So if you allow me to touch on that. And I think it's great that we're actually in the City of Champions today talking about this. Because it was only yesterday in the London Marathon, one of your own broke for the first time the marathon in under 2 hours. So Sebastian, why is this important? Why do I raise it? It's because, you know, even as a high-performing athlete or a high-performing worker, you can't sit still, all right? Somebody's going to try and eat your lunch. What Sebastian used a lot of, and all the high-performing athletes are, they're using technology to enhance human performance. So how do we use technology in the workplace to enhance human performance rather than undermine it? This is what I want to touch on 2 points. So first of all, what's happening in the world of technology? Many of you have probably heard of Moore's Law. I'm not sure if you have or haven't, but for those that haven't, Moore's Law is a core law of technology where the rule of the game is that every 2 years the capability of technology doubles. Okay? On the way out here, I looked in the shops at the airport in London, and you've now got SD cards for cameras like they're using here today that can hold a terabyte of data. It was only a few years ago, 16 gig was as good as you got. Right? Technology is moving forwards. That every 2 years the capability of technology doubles. Ask ourselves as workers, OSH professionals, government professionals, are we twice as good as we were 2 years ago? Yeah? Are we going to be twice as good as we are now every 2 years? The second point is that also the price of technology comes down on average by 16% a year. So are we either 16% more productive each year in the workforce, or are we 16% cheaper in the workforce? If we're not better or cheaper or adding more value, technology will be taking our roles. So we have to think about this as a society. You know, how do we leverage technology to make it a strength and make us faster, like Sebastian? How do we make us better? Because if it's not, technology will eventually replace us. And this is what's happening at the moment. There's like an arms race happening across the world, where those that are customer facing and therefore more difficult to replace because people want to deal with people, technology is being used by organisations to make them better. Where people are not technology facing, largely back office professional services roles, accountants, lawyers, things like that, you know, technology is replacing it. In India alone this year, 250,000 jobs will be lost in the accountancy firms because technology is replacing those jobs. So when it comes to psychosocial needs, what we're talking about here, you know, is technology helping us to be better in the workplace, or is technology threatening us? And this is the big thing to focus on. When people are working in organisations as OSH professionals, pay attention to the departments that are less customer facing, because those are the departments where technology perception in the workforce is increasing psychosocial risks. Those that are closer to the customer face less psychosocial risks. Now, why does that matter to us? And this is the second point, is that to understand psychosocial risks, you have to understand human behaviour. And the best model to understand human behaviour is really old, even older than me, which is Maslow's hierarchy of needs. And it is critical to understand it. This one thing from what I'm saying, take away, is this. Okay? Because human behaviour starts with physiological needs. Can I eat? Can I sleep? Do I have shelter? Is someone going to hurt me today? Is my job going to be taken away from me today? Only and only when those physiological needs are satisfied do people move on to the next consideration, which is safety needs. We all know that, if you think about it, in the workplace, if somebody is threatened with their job, they will take more risks. Somebody that is hungry will do more for their family. All right? The basics are pay your people on time. Yeah? Take away those fears of physiological needs, and then the workforce will focus on safety needs. Again, I come back to what I said. Those roles where people feel safer in the workplace, where technology is helping them do their jobs better, will be more ready to accept your support around greater safety in the workforce. Those that are scared of their jobs, those that are under pressure, boutique picking places here, for example, where they're under pressure because technology can replace them, they will take more risks in the workforce. This is what we're seeing elsewhere in the world, even highly advanced societies like Singapore, for example. Certain roles now, the workplace harm is going up. Why? Because they fear and threats of their job. Those that are going down are the ones where they see technology helping them. Do you understand what I'm saying? Yeah? I do have a third one, but perhaps for now I'm mindful I talk too much, so I better put on the third one if we have time. Thank you.
Yes, thank you, Ian. That was very well detailed. I want us to build on that, and this is going to Sylvia. Build on what Alan has said, Sylvia. Clearly, we all agree, Alan has touched on the same, Alan has, technology is here, and we will continue rolling out new technologies every year, every month, every hour. Probably right now, there's a tech company doing the same. So, this is our reality. But then how do we integrate these psychosocial risks, even as we roll out this new technology, without compromising on innovation, because we want to grow technologically as a country?
Thank you for that question. So there are a couple of things that we'll need to start looking at differently. One is to embed safety by design when we are doing innovations. What do I mean by this? I'll ask you a question. Has any of you done a psychosocial risk assessment? When maybe you're in the transport industry, you're in the logistic industry, and now you have rolled out a new AI tool for scheduling, or a new AI tool for optimization of the transport routes. Have you done a psychosocial risk assessment? What does that mean? It's the same exact thing we do under safety risk assessment, where is identify the hazards, analyze the risk, and come up with control measures. So the first thing is to embed safety by design in the process of when you're doing your innovation and coming up with your tools. The second thing that we have to consider very well is worker consultation and participation. Has any of you been called out to be part of a pilot when a particular tool is being rolled out in your company, and you're told use this for a few weeks to see whether your workload is going to increase? What do you feel about surveillance? Maybe right now some of us are here, and for those of you who use technology like to communicate, maybe your Slack is on, your Teams is on, So you said you're coming for a conference, but you're still having the anxiety that in case a message or a notification comes through, you have to check it. Yeah? So worker participation and consultation is going to be very critical. The third thing is our leadership. Is our leadership have they been trained on psychosocial risks? Or are they using, for example, I'll give an example, surveillance. Are they using the surveillance to reprimand the employees such that now employees are thinking, I have to do this particular work because either or not I'm being checked? And so you just have something we call presentism, where you're present but you're not even engaged. Or are leaders being taught on psychosocial risks such that they use the surveillance and the data they're obtaining to train the employees, to coach them, here you did this wrong and you can do it better. So those are some of the things that we can start using and embedding when we are doing innovation so that it is catching up at the same level, like when we are looking at financial risk, cybersecurity risk, data protection risk, we need to start looking at psychosocial risk at the same level in the beginning.
So, Sylvia, thank you so much. I hope you're noting down some of these key points. This is not information that we get on a daily basis. We go to the next panelist, Rebecca. Rebecca, from an employer's perspective, some of the things Sylvia has touched on, they represent so many risks for the employee. For example, what she mentioned on surveillance, there comes in surveillance fatigue, you have burnout, right? So how do we protect the employee even as we embrace new technology?
Thank you, Cynthia. Probably I would start by us understanding when we talk about the hazards. For example, burnout. So what is burnout? First of all, we have to understand that burnout is a prolonged exhaustion, a chronic exhaustion that tends to affect us emotionally, mentally, on what we do. So even as we talk about technology, how do we look at it in terms of the burnout? Yeah, because we are probably just overdoing it for a very long time. Step by step you think that it's okay, then you realize, you cannot be able to be controlled over it. Just as we say, like right now, how many are here but are still doing their emails, responding, talking back at work? A WhatsApp has come in asking you a question, a boss is asking you, and you're just wondering, what is wrong with this person? He knows very well I'm in a conference, why is he telling Nika, why can't he tell Vivian? And all that brings that aspect, getting exhausted, reducing the morale of even working. And when you look at this, it affects in terms of maintaining the gains we get from the productivity that we do. So which increases the stress level. So it's very important that we understand when burnout comes out. What are the signs of burnout? Just as the key speaker said, when do you feel you're too exhausted and you cannot do it anymore? That is when you realize you need to be able to take care of yourself, be able to take a break, take that walk that needs just in a simple way to understand. We talk about the surveillance, we wondering, is somebody watching us? It creates a lot of anxiety. But what I think we can do is enhance more of trust than making this as a tool of control. How can we be able to trust our team members? How can we be able to, you as the leader or you as the colleague, trust each other so that we do not make this surveillance more of a control tool, but more of a safety place that we know can be so safe to enhance even innovation. Yeah? Because when you feel you're being monitored, it increases the more aspect of anxiety. So So I think we encourage each other to understand that as much as this technology is there, it should not really come to harm or increase the hazards that we are talking about, but to be able to help to increase or to make people more innovative about it. That again comes to another aspect of, the life-work balance that comes on it. When do we stop? Yeah? So when we stop, we go home, you reach home, you put your bag there, you don't even remove your clothes, you're still in your suit, you've gone to the kitchen, you are cooking, haraka, you give the children, you go to the email and they eat. At least you have 1 hour before they finish eating to send this email. So when do we stop? So even as industrial organization, just having policies that are very clear to help us know by 6 o'clock, you cannot respond to that email. By 7 o'clock, you can call back and say, you can be able to respond. And somebody will know automatically that email cannot be responded. Because now, how do you balance home and so? And that's why this hazard has even gone all the way back to our homes. Even balancing how we relate with our family members. Your children are always daddy is working, mommy is working. You don't know when to say no. And when you realize this, it really is affecting in terms of how we, as time goes by, just as burnout again, slowly by slowly, we get exhausted and we cannot maintain the productivity gain that we've had in the first place. So even as this technology comes in, the human aspect has to be very clear. That is the empathy, understanding and being in a place where we can be able to manage or take care of problem-solving skills that we ourselves are inbuilt with, that could be able to be affected in terms of the technology that may lead to not being able to balance our work, leading to fatigue, leading to anxiety, or leading to burnout that we experience today. Thank you.
Now, clearly, the first wave, second wave is here. It's reshaped the world of work and how we work. I'll come back to the panelists for your closing statements, but first, I want to open it up to our audience. This is a Q&A session. I'll only be taking 3 questions. If you have any additional questions, I'll come round and we'll capture those and share with the panelists. I hope that is okay. So if you have a question, there's someone moving around with a mic. You raise your hand and the mic will be brought to you. So just raise your hand if you have a question for our panelists. Anyone? Is that a good sign? We've loved the session. We are satisfied. Yes, there's a question here.
Good morning. My name is from Kenya. I just want to thank the coordinators for this session, for really a very eye-opening morning session, especially from Florence, and this is a follow-up from that. And we have examples globally where systems have been put in place to recognize signs of psychosocial stress at work and immediately move in to respond. And where we were talking about compensations, I was just cracking my head and wondering how would you work around the percentages where you want to compensate somebody for the same. So really there is quite a lot of ground to cover within, but we're also interested to check out there, is there someone who has cleared the gray area completely so that you can talk of a 5% finger loss, what would be the equivalent to, psychological, impact, so to say. Thank you.
Thank you for that question. That's a two-part question. The first one is on the tools. So, Sylvia, you can put this on, and Rebecca.
Okay, I'll answer the first part. So Japan actually has a very robust system on psychosocial analysis annual. They actually do it. And France actually has embedded it in their policies whereby you're able to have a digital break. Like the way she was saying, continuous. They are allowed to have that in their laws.
On the science, it's more the same on the psychosocial, the psychosocial risk or hazards. The science tend to be very clear, more in line with the mental health aspect of it. So when we talk about, like right now, when we're talking about technology, so how do we be able to identify the signs that somebody is going through maybe is going through burnout or going through any kind of psychological risk at the workplace? First of all, one of the most recognizing symptoms would be withdrawal. We have most of the employees, a very hardworking person who is doing very well, all of a sudden they do not have the morale to continue. They withdraw. They do not talk or participate the way they used to do. Another signs will be coping mechanism tend to change. So somebody who used to drink a bottle, maybe in the evening, masazake, all of a sudden they have gone into alcoholism. They have gone into drug, as a coping mechanism. Others will be able to see symptoms of being very irritable. How are you this morning? They are not answering, or they're just, why are you asking me? You can be able to see something is off. So these are majorly some of the major symptoms that we pick. And in the process, we are losing a lot of good employees because probably we are not in a position to recognize that something is off. And instead of probably addressing it, we are gossiping about it, isn't it? We are talking to each other about it. We do not want to make it, so the more we talk, the more they withdraw. The more you go to them, the more they become defensive. So probably as we understand these symptoms and we can be able to train more our leaders, wellness champions, peer educators in our teams, to be able to identify, these symptoms that come in line with the mental aspect of it.
Maybe to just add a little bit here. Yes. This is one area where I'm in a division that works with prevention, preventative. And my colleague, Dr. Andrew, is in compensation. And there are places where sometimes I see like we need to draw the line. Because something like psychosocial hazards, we need to nip them in the bud, get them at the earliest time. We detect them very early because we need to stop them before they get to that level where we are thinking of compensation. Because at that time, you can imagine what has to happen. There must be some doctors, some psychologists that must come in and put a quantity, it becomes so messy that the best thing is we detect psychosocial issues early enough and prevent, and then put in all these areas that are preventative measures that will actually stop the problem right at the beginning. Therefore, you find, and I believe this is why we are here today, what we are speaking about is trying to make sure that nobody gets there. Nobody gets there. But if they do get there, then of course the rest must be done. Compensation must happen.
Applause, please. So we're out of time, but there was one question at the back. The rest of the questions, we'll have to write them down and share them with the panelists. I hope that is okay with everyone. So there's just a question here. Yeah. Mike, please.
Good morning. I'm Ezekiel from Kenyan. I just have one question, and so how do we measure the magnitude of the social harm to the worker? And I heard also one of the panelists talk about the auditors, and she talked about to audit the psychosocial harm. Now, are these auditors also trained? Because somebody cannot do something they are not trained for. If they are not trained, what are the tools they use? And now, how do you measure that? This one is at this magnitude, and the other one is at the other magnitude. So because I work in different workplaces, there are workplaces whereby the management orders and you don't question them. I've been in some places, I do diving, so you can go down under the water, do some work there and come back, and then you see some people when they come up from there, you just read it from their faces and know that something has happened to them. Now you go even saving lives. 2 people, you rescue one, another one dies. You spend sleepless nights because think about the other person, because she is a human. So how do we measure this money, and how do we now come to the conversation? Thank you.
Yeah, thank you. I mean, in terms of measurement, I think there's a real opportunity for us as an Austrian community to go deeper into measurement of accidents and stuff in the workplace. There was a piece of work done in Qatar by IOSH members around the time of the World Cup, because lots of people were falling off buildings, crashing cars, things like that, and they were being recorded on that basis. Somebody had a crash, somebody had a fall. But what they did is they went back and asked, why did somebody have a crash? Why did somebody have a fall? And what they discovered is almost invariably it was the underlying psychosocial issues that were resulting in what we basically see as slips and trips. All right, so we as a profession step up and ask more questions as to why, what is the real root cause of this, and then we'll get the data about the significance of psychosocial risks, right? So that's the first point. And the second point, if I may, is that we know full well across Western Europe, for example, the harm of psychosocial risks, where we've made great advances with around, other areas of health and safety. Now one of the biggest causes of death in under 30s, particularly teenage girls, is suicide. Why is that the case? Because their addiction to social media and the online bullying that's occurring there. Not every goon wears a mask and carries a club or a knife or a gun on the street. The bullies that are doing harm and hurting people are the online bullies. The ones that are busy on WhatsApp and LinkedIn and things like that. They are the biggest cause. Kenya has a young workforce addicted to their phones. They look at social media all day long, and we know who I'm talking about. People that are bullies online are cowards, no more than that, and they are harming more people now than people driving badly on the streets or not taking care of traditional DOSHS. It needs to stop. If you haven't got something nice to say, don't say it. Thank you.
I can add a measurement that if you look at, I believe the draft, we're still calling it the one that we sent for consultation for public participation, the COP on psychosocial management. You find very many matrices on how to go about the different hazards, ecological hazards, such that it's possible. They've come up with a way of, if it's an issue of bullying, like Alan is talking about, there are criteria that is used such that in the end you can actually be able to tell how much harm has been done. So there is a way of calculating that. It's something that probably we all have to go back and read a little for those who are auditors and the inspectors to make sure that at least we familiarize ourselves with this.
Okay, to add on to that, there are also things like companies have what we call engagement surveys. Most companies do it now. And some of the questions are related to how engaged do you feel to your work? Do you feel like there's pressure? And based on those answers, it becomes a very good indicator of psychosocial risks. Another one is HR. You can work with HR, and HR has very good data on absenteeism. They can help you to track that, and you can circle back to the root cause of that absenteeism. Also, we have within safety our incident rates when you're doing root cause analysis, our near misses, our error rates. All those are good indicators that can help you with psychosocial risks.
Thank you so much for that. If there are any other questions, please write them down. We'll share them with the panelists. Now, this is the last stage, closing statements. We've all agreed that technology is here. There's nothing really we can do about it, but learn how to use it safely. But even the companies that are introducing these new technologies protect employees even as they continue to integrate them into their operations. Now, we'll start off, I know introductions, we started on the other side. So, start with Sylvia. Sylvia, the floor is yours.
My closing remarks is we have a choice now as a country, as a regulator, as employers, as individuals, to decide whether when we are moving forward, we are going to automate the harm, or we are going to embed psychosocial risk assessments and review, so that by default, we are going to have healthy workplaces and healthy automation of technology. So the choice is ours. Yeah.
Thank you. I'll just repeat back what we've said and my colleagues here have said. Technology's here, but are we checking in on people? We've never in the history of human existence had the opportunity to communicate and check in on people. Yet we're using those tools collectively not so well right now. Checking on people and be nice. Got nothing bad. If you've got nothing good to say, don't say it, because it hurts. Thank you.
Well, mine is just to say that technology must serve people and not the other way around. Such that now all you have to do in government is to ensure that whatever technology has been adapted, whatever we are using, it is actually helping us ensure preventative culture in our workplaces and to make sure that our workplaces are safe and are productive.
For me, I would emphasize more on the human aspect of it, probably because of this psychologist I am, and to just be able to say, in workplace is very workable, that we can be able to put in place guidelines that can help the employees. And I'll basically use Kengen per se as it is. For us, we have a very robust employee assistance program that we really use to be able to assist our employees. And one of the best things would be counseling. The fact that I'm employed as a psychologist in that company in itself tells you how important we can be able to take this social aspect in our organization to provide the access to our employees, to work with the service provider and other psychologists, which we use on our panel, to be able to tell our employees, you can talk to somebody if you feel like you're really reaching today, talk to somebody. Let your children talk to somebody. You can go for that, in case of trauma, you can still be able to get support. And so we want to provide this from our employee assistance program. Another way we are doing it is by creating awareness. Every day, every time, emphasize on the aspect of wellness to the employees and let them know that it's a very key aspect of safety in the organization, because when they take care of themselves, our productivity goes high and safety risks are reduced. So we are able to tell them and create awareness through, like for us, we have pink energy for the ladies, blue energy for the men, white that takes care of the youth, and be able and we also have mentorship programs just prepare the next generation. And in this process, we're able to handle the hazards that we do not see. Because technology is coming very new. The Gen Z are coming with something new. The other group are still struggling, don't know what is going on. And even the types of training, we have very wellness champions. I think even some of them could be here. We have the wellness champion or peer educators, which we train them to understand the science of issues to do with mental health or stress that comes from technology. The supervisors are also a key, which we train them all the time to be able to understand. Just as you say, most bullying comes from people saying, my boss is like this, my boss is like that. But if we train them, we reduce the hazard of bullying. We reduce the hazard of managing the conflict that come between the co-workers. So those are some of the things that we're able to do. Learning again, AI is as we're saying, is evolving. So we are using programs like LinkedIn, for example. For us as employees, we all subscribe to it. So you can go and learn one or two so that you're not so scared that tomorrow you will not be able to fit in the organization. So for me, my closing would be more, even as we talk about technology, let us not forget the human aspect that comes with it. Thank you.
Round of applause, please. So I want to thank you for accepting the invite and agreeing to contribute to this very important conversation. For me, as I close, we set aside so much money towards physical hazards in the workplace. If you think about your budget, it's huge, right? For me, sometimes I think when you talk about psychosocial well-being, sometimes it's just a case of meeting me at the door and saying, hi, how was your weekend? Or if you see bullying online, or if it's happening wherever you are, just because it's not happening to you does not mean that you cannot speak up. Speaking up goes a long way in protecting people, even as we continue to embrace technology. So thank you so much for staying here, listening, and contributing to the conversation. Asanteni sana.
Thank you very much, Vivian, and all the panelists. Vivian is a member leading Light in WASPA. She has supported us. She was a member of the organizing committee. And the panelists, thank you very much for having time to speak to us. At this juncture, I think we need to have a health break. But before the health break, we need to recognize the presence of some of our stakeholders who come in and we are giving the presentation. I will give them 30 seconds each and also remind them that we have a bell. And as we stand up, I want to invite a representative of NACOSH. I don't know who among them will stand up, introduce the others and speak to us for 30 seconds. One of the members has stood up, so we will guide.
Thank you, Simon. Let me just ask the members of the National Council to please stand and just come to the floor. For those who may not know, Occupation creates the National Council for Occupational Safety and Health. This council is a representative council that has tripartite representation and industry representation, as well as different technical department representation. This is the council that thinks and advises the cabinet secretary on matters related to occupational safety and health. So let me just give each of them a chance to just say hello, give them the name, and we give them a small having made it up. Start our host.
Good morning, ladies and gentlemen. My name is Felix Longmajine. I'm an independent representative appointed by the minister. to the council. And I reside here, although I originally come from Narok. You're welcome to this city of Toronto. Thank you.
Good morning. My name is Timothy Royu. I'm a mechanical engineer by profession. I studied here many years ago in Eldoret. I'm an independent member. Welcome to this session.
Good morning. My name is Anthony Wainaina. I am a representative of the Ministry of Health in Nakosh. We work very closely with the whole enterprise of DOSHS, the Nakosh, and all stakeholders. Thank you very much.
Good morning. My name is Robert Orina. I'm also a representative of NEMA in the Nakosh, representing issues through the environmental, safety, and of course, the workplace environment. Thank you very much.
Good morning, everyone. My name is Obed Mnege. I am an independent member of the Nakosh. I'm also an occupational activist. And out there, I also practice air quality monitoring. Thank you.
God is good and all the time. My name is Mary Onsarigo. I represent the National Commission for Science, Technology and Innovation. I'm a principal scientist, and I hope you heard of Nakosti. So I work closely. I think I'm among the oldest member of this Nakosh. I'm in my final year, and I've really seen this directorate growing. And thank you, Secretary, for the good work you've done. Our Vice Chair, yeah, she's on her way coming. She's around, but I think something she's looking for. She went to get some medication, but she's around. So thank you so much for this opportunity.
Thank you. These are the members of Nakosh. Allow me to also, times you do get an opportunity to meet some of the old faces. I'd like to recognize Mr. Nyongesa. You can just stand up and wave. Give Mr. Nyongesa a big hand clap. For a long time, Mr. Nyongesa was the head of field operations in DOSHS, and now he is a consultant who assists us with a lot of the work. I'd like to recognize our colleague from the Parliamentary Service Commission. You can come and say hello.
Allow me to write the protocols I established. I'm Samson Robert, working parliament. I'm not a parliamentarian. I'm the technical staff. I'm here with my colleagues representing Parliament Safety and Health Committee. With your permission, Secretary, allow me to ask them to stand and be acknowledged. If those colleagues can be upstanding, thank you very much. Thank you. Take your seats. We are privileged to be with you, the Secretary and the team from Nakosh. Parliament occupies a very special space in matters safety and health because we have clients that help you reorganize the legal regime around safety. And it's important that we work together to ensure that that regime is aligned to what is being discussed here today. And that is why we are here together. We are walking in the steps of, and also privileged to stand on the shoulders of the giants, particularly DOSHS and other stakeholders, to be able to grow the safety space within Parliament, to make sure that Parliament is aligned and also understand the emerging issues, so that as technical staff, we can be able to protect that space, so that you, the employers of the sovereign, can be able to benefit from what you do to make Kenya the best place to work in. Thank you very much for having us. God bless you.
Thank you, Major Scobit. I think sometimes we engage with projects Sometimes Parliament, they make legislations for us. But I think we appreciate that we are all workers, and we are committed to work with you to ensure safety and health, and we are committed to work with the Parliament to enact to work on our legislations and regulations. Let me give a chance to Dr. Mitanga. There are a few persons who we would like to recognize for us to just recognize them in this moment.
Thank you, Secretary. I will just mention their names. GDC Limited. We have Kenjen. Maybe they can stand. We appreciate them. Thank you. The team from Kenjen. Kenjen team. Thank you very much. MTRH. Thank you. I think we have recognized Parliament who are here. Thank you very much. The WASPAC team had been recognized. Kakuzi, PLC. Patson. Thank you. All Power. EPRA team. Thank you very much. EPRA team. Thika Power. I've seen Thika Power here. Thank you very much. KPLC, Kenya Power, I've seen you here. Thank you very much. Saji Labs, I think they're also exhibiting out there. You'll go and visit their table. Adi Waterworks, I've seen them here. Adi Waterworks, we recognize you. OML African Logistics, they also have there. ILO, somebody from ILO, we had recognized them earlier. Geminia Insurance, I think those are the ones that we have right now, and thank you very much.
Back the mic to the sessional MC. Thank you.
Thank you, Madam Secretary, for taking the call is very difficult when you speak to your sponsor. You have to hold your horses. NACOSH are the sponsors of this program, therefore when you even uttering their words, you want one of them to speak on their behalf. I want to have a last laugh by inviting Mrs. Simiu, who is Engineer Simiu, I don't know the title, representing the DG EPRA. If you're in the house, can you please stand up? We have a lot of support from the energy sector. You could have your 30 seconds, say, and we recognize your support. Thank you.
Thank you so much. Good morning, all. Yeah, my name is Engineer Tom Siliu. I work for EPRA, Nairobi. In EPRA, we have a committee called Energy Sector Safety Committee, composed of membership from the energy sector agencies. And some of our members are here. I'll just ask them to stand up so that we can recognize them. Safety committee members, energy safety committee members can stand up. Yeah, so because of time, we can just applaud them with a clap, please. Yeah, we will have a session, a short session, I think later on, where we can give a small talk on our role, so that you can know what we do.
Thank you very much, Engineer. We appreciate the support. It is also good to know that yesterday, thank you very much for the support. We really appreciate, we see that this is growing from 20 years ago to what we have now. We've really grown, and we got. Yesterday, for those of us who were here, we wanted to go to church, but we all the road because there was a marathon, and it was a very interesting marathon. But likewise in London, there was another marathon, and a record was broken by one of us from Eldoret. Let's clap for talent. It is not gloom. we had a celebration and it is a good time to take a break and have a cup of tea. We will take our tea adjacent to this, and I want to request those leaders of delegations who had a chance to speak. Our secretary and your delegation and the presenters, because we have so many, we have a group photo just outside the hotel as the others take tea. Heads of delegations, NACOSH, presenters, let us all just walk out, take a group photo, then come back to tea. Thank you very much. We resume after our program for 30 minutes. 30 minutes, the bell will ring and tea will not be served anymore. Thank you very much. Let us be seated. Let us be seated. Engineer Mariaka, we are waiting for you to sit down and start the timer. I want to thank each and every one of you for your participation in the morning session. We are going into the mid-morning session. Welcome our Vice Chair. I want to welcome the next session Master of Ceremony, Dr. James Milanga, to take us through the next of the session. Thank you very much.
Thank you very much, Simon. I want to welcome you back to this mid-morning session. So I want us to, this time around, we are going to keep time. I also want to request all the presenters to be near. Then make sure your PowerPoint is with Wanagateya here. Then I also want to request all the panelists to be ready so that we can move quickly. We are going to follow the timetable as it is in terms of the session. Since the keynote speaker has spoken, she spoke, we are going to go to session 3, session 4, session 5, then we will have 2 more presentations before we go to the panel discussion. Then we'll break for lunch. That is the order of business. But before I call the first presenter, allow me to recognize the following companies that are here. Compassion International, maybe you can rise. Compassion International, we can clap for them. Thank you very much. Allow me to also Kenha. Members of Kenha, please, you can rise up. Please recognize them, please. Thank you very much. Kenya Seeds Company, we also need to recognize your presence. We can clap for her. Allow me also to recognize Moredat Institute of Oil and Gas. Thank you, Moredat. Allow me also to recognize KEBS, Kenya Bureau of Statistics, Standards. We also have statistics people here. Thank you very much. I will continue recognizing the companies as they come. I also want to recognize the presence of Safaricom. Makofi kwa Safaricom. Thank you very much. So allow me to go straight to the first presenter, but before that, thank you. I was being reminded that we are supposed to pick our tags from behind, but since we have settled and seated, I think we'll do that over lunch hour, okay? Because I don't want to disrupt the session. So as companies continue streaming in, I will continue recognizing them. So our first presenter is Dr. Melanie Murgo. Dr. Murgo is an OSHO, but specifically she deals with occupational health. She is also an ambassador, a World Health Organization ambassador for the age-friendly cities and communities. I think we need to clap for her. She also sits in the World Health Organization Youth Council. That's not a small thing. And we are very proud of her as DOSHS. So allow me to welcome Dr. Melanie to start us off. Karibu sana daktari.
Thank you very much. Good morning, everyone. We're going to have a very brief session about some work that we did. One of the work I actually did it this morning, but I'm happy to share with you on what this is about. Many a times when we stand on this side as the regulator and government, we're usually pointing hands to others, or the private sector has not done this, or the private sector this and that. Today's theme being on psychosocial work environment is broadly misconstrued to just mean mental health. But that's not the case. It's bigger and broader. When you look at the data, we are told by the year 2030, the leading cause of death will be issues of mental health conditions, specifically depression. How far is 2030? 4 years. 3.5. So you can imagine there's this big magnitude of a problem that is coming, and we need to be prepared. There's already some steps we've done, yes, as government, but there's more we could do. When you look at your life, how much percentage of it do you spend, or do people spend in the workplace? A quarter of your life, I hear. Any other response? Yes? A quarter of your productive life. That is true. And if you look at it broadly, it's almost 2/3 of your life. Because many people start working from the age of 16 all the way to 65. So you see how important this is. When you look at what we've discussed during the morning sessions, we've heard a lot about what specific organizations are doing. I listened very keenly during the panel sessions on what we need to be doing. So let's look at what are we actually doing? What Now that we know all the theory, what are we actually doing in practice? So the gap that we're looking at specifically is on the mental health being a major workplace risk, but it is not treated as one. Many times, even today, there are so many psychosocial hazards that I can see from the time we walked in, but we are not even recognizing them as that. It's that. So what did we set out to do? We set out to look at two specific things. Are psychosocial risks being recognized, assessed, and managed in Kenyan workplaces? This is work that was done jointly by the Ministry of Labor. So as the OSH practitioners, we looked at the risk assessment issues and the training that we are doing in the workplace. The Ministry of Health looked at specifically, if we find workers have a problem, are we actually providing the support framework that is required? Then number three, we had Ministry of Public Service, Human Capital Development and Special Programs. Specifically looked at these public sector workers, what are the issues that are affecting them in regards to mental health? Just specifically those three questions. What I'm going to present right now is preliminary findings of the survey. This is what I've just described as what we looked at. So let's start with the first thing. How did we do this study? For the public servants, a survey was sent out through a Google form, followed the structured framework of how to screen for depression, alcohol and substance use, anxiety, and we asked questions on supportive frameworks using the standardized tools. So not new reinvention. In terms of the other frameworks that we looked at, for training, specifically we asked during this month of April, because this is a month that we are focusing on psychosocial work environment, right? So I asked all the trainers, some of you responded, some didn't, to send me their presentations that they presented to the workers they trained, and to send me the timetable, the curricula they did, just this April. Then for the audits, we looked at all the audits that were done and submitted to DOSHS in April that were reviewed and approved. Did not pick any audit of the same workplace or of the same auditor. So different auditors, different workplaces. When I say workplaces, on this I'm looking at, if you have a branch, we'll only pick one. So that's as simple as we just looked at that. And we're looking at specific things. So let's look at the answers. The survey findings. You remember what I said, by the year 2030 we'll have depression as the leading cause of death, right? The first survey finding tells us 47% of public servants are moderately depressed. 47%. The number we have, I think officially, we are about between 900 to 1 million. So 500,000 public servants are moderately depressed. And on this, it goes further to stratify those who actually been diagnosed and on treatment, but those who just, based on the survey, were at risk or then required to be referred for treatment and care. What does it mean when you have a large workforce that is depressed? That becomes a labor issue, and why we are discussing here today. There are various other factors that then, we teased out, or which we will not go into details this morning. Issues of work-life balance, job stressors, basically a majority of the things that was discussed during the session this morning. The other concerning thing, we're like, okay, now that people are saying they're depressed, do they actually access services? And we ask in the workplace, do you know you can call someone for help? Do you know there's a specific directorate in the Ministry of Public Service specifically to cater for mental health issues of public servants? Do you know that SHA or the medical cover adequately covers you for this? What was the response we got? 38%. So if we are having sick workers,
and close to half of them are not aware of these services or cannot access them. You see, we've identified the problem, but we're not fixing it. We're barely fixing it. However, there's some good news. For those who actually utilize the services, about 70% said they liked the services, they appreciated, and it was useful. This is good because if we are saying 48% are unwell or near unwell, if we give an intervention and it is able to respond to the issue that they're having, it means then we'll be doing something. I will not go into all the other questions. It's actually a whole, it has many, many other parameters. Maybe something that is significant is the use of substances. And on this we screened specifically for alcohol and then did a general screening for substances. 58.1%, more than half of public servants are using substances and abusing them. Not just use, abusing, and many of them are becoming sick. If we continue with this trend, by 2030, we will close down our hospitals and will not have workers. This is not good. This is across sectors. So, health sector, service industry, construction sector, zero. When we looked further into some of the recommendations, only one report recommended something on stress. Like, I think it was one sentence that measures to reduce stress burden of the workers need to be instituted. Now remember, the workers are sick, but we are not identifying it here. These are reports that have been submitted and approved. So important for us to look at it as a systemic issue, where the gap, so that we actually institute important measures. Went to the next question, training. So specifically looked at two types of training that was being done. The DOSHS training and the workplace improvement trainings. For the workplace improvement training, we only found one institution that had done in April. But for the DOSHS trainings, it's been ongoing on. So we asked all those who had done trainings to share two things: the presentation that was presented to the workers and their timetable. We got 22 trainers who responded. Out of these 22, they did some really good job on a couple of things. They trained on stress management. Very good, excellent. They trained on issues of substance use. You remember the two things we said is affecting public servants. So at least this was being covered. Most of it was on sensitization. When now you go look at the content that is being delivered, is on sensitization. The thing that was missing was going back to the risk assessment. We're not telling people what is a psychosocial hazard, what will lead you specifically to that stress, how then do we mitigate based on how we do in terms of hierarchy controls. So out of the 22, 0 delivered content on psychosocial hazard identification, risk assessment protocols, organizational interventions. And this is important for us to take a step back and reflect and say, yes, we are saying we are doing a lot of good things. Yes, we have a code of practice that is telling you to do this. But if we are not doing it correctly, then we will not be addressing the problem correctly. And this is a system problem where we need to take a step back and look at where then do we intervene, what kind of intervention do we give at this point. This is the system disconnect that I want us to reflect on today. We've said more people are depressed, more people are using substances. However, when we look at the practice, we are not assessing it, we are not documenting. Therefore, if it's not risk-based, will it be budgeted? Will resource be given from just the institution even before we go to government sector-wide? You see how the system disconnect comes in. So yes, it's a major workplace risk, but severely invincible within our DOSHS frameworks. And that is what I want us to look at today. So what are the implications? Of course, sick people cannot work, they'll be on sick off, there will be a lot of presenteeism, absenteeism, you'll see a lot of this. Errors and accidents. In the morning we heard about burnout and stress implications, quite straightforward. It then comes back to us, how then do we improve our OSH systems? We have enough documents for that. It's just how then do we implement it better? So what do we want to do now moving forward that we've seen the problem? Two things. Yes, we need to improve the awareness, and looks like this needs to start from us before we go external. The data and surveillance, whatever I've told you, however it sounds disappointing, it's the truth. But it's only for us then to say, how do we improve the trajectory of this data? Proper referral pathways, we work in a very fragmented manner, from labor and OSH system versus all the other plug-in systems. The healthcare system is very important. The social protection system is very important. Issues of gender, issues of trade, very important. So we really need to look into how then do we intersect OSH in all that. Finally, we have a code of practice. While it is undergoing the final administrative issues before it is presented to the public, we don't need to wait for it. We know what needs to be done, and we need to start doing it. The code is already ready, so it should find us already implementing part of it. Now that I've said this, the problem, we've seen the gap, we've seen the issue that is there. What do we do moving forward? We are here until Thursday. Friday is a holiday. From next week, we are back to work, right? So I checked into the DOSHS just a few minutes during break time, and I looked at how many audits, specifically now I looked at OSH audits which have been scheduled to coming up. We have 1,022 audits coming. And it is my hope that if we can just commit that all those auditors who will go to the field starting Monday, put one issue on psychosocial hazard, just that. If we can commit that every trainer who is going to do any training in May, we have a psychosocial hazard. Any doctor who is going to do medical assessment to actually screen for psychosocial issues, we will have met our goal. We will have made a contribution to supporting and reducing the burden of mental illness in this country. I'll stop there with this quote. What gets measured gets managed. Psychosocial risks must be made visible. It is only us who can make it visible in our systems. When we go for inspections, can we write that issues of psychosocial hazards have not been factored in the workplace? Thank you so much.
Thank you very much. Thank you very much, Dr. Melanie. Hiyo makofi hajatosha, please. Thank you. I think that is good enough. For me, before I call the next presenter to recognize the presence of our Vice Chair, NACOSH, Madam Rebecca, you can say hi to people. Good morning. Thank you. Allow me also to recognize the presence of our approved persons. We have so many trainers, approved persons, DHPs, fire safety advisors, so we want to recognize your presence. So makofi kwao, I'm sure they are around. Would you want to see them, led by our council member, Obed? And the rest, if you are an approved person, just stand up so that we can acknowledge your presence. Thank you very much. These are the people, wapigieni makofi. Our next presenter, so our next presenter is Godfrey. As written in our timetable, Godfrey Osundwa. Godfrey is a mechanical engineer by profession. He has been working since 2021 with a company called Ormat, and I think he's going to be assisted by Lenny, who has been a HSC officer since 2020 from All Power. So karibuni sana.
Asante sana. Good morning or afternoon? Good morning, everyone. Good afternoon, everyone. You know, Lenny, I'm seeing people, they are very smart, they are very beautiful, but there is one problem. I can't see any smile. That means they are experiencing psychosocial risks. So, I want you to touch your neighbor and shake their hands on your left. Tell them you are the best person I've met in 2026. My name is Godfrey Osono. I am a mechanical engineer profession. I've been working with Oma Technology since 2021, and I'm happy. So how many of you can see me? Just raise your hand. I don't know why it is getting darker when I'm getting to the stage. I remember there was the time I was doing a presentation in high school, and my fellow students were like, we can't see you, we can't see you. And they told me, smile, let's see your teeth at least. So it's about my complexion, but can you see me? Raise your hand if you can. Raise your hand if you can't see me. Okay. So Lenny here is a safety officer at our place. I've worked with him on the stage just to give me more confidence so that psychosocial does not affect me. But you touch some of the things that I did from here. So I called my presentation as Beneath the Steel because we are working in a geothermal environment. I've used it metaphorically, not being. Wonderful. So beneath the steam just to mean every pressure that a person working at geothermal environment experiences. A well-developed pressure builds a pressure up to, let's say, 70 bar, and if not controlled, it might burst and cause damages. So we did a small research after realizing that the working environment was getting toxic. So 68% of the geothermal workers at our place reported sustained psychological distress, yet only 23% realized that there was help. So, at our place, Lenny here protects everyone, ensures that all the physical hazards that can take place at a geothermal working environment is taken care of. Say steam pressure, fire, gases, and all the hazards that you can imagine at work. But who protects them from the silent weight that they carry home? So I always say that if God has given us the third eye so that you can see what people are carrying in their mind, ungeona watu na magunia ya stress, but we can't see. How do we solve this? So imagine at night an operator called Sydney working at a geothermal power plant, operating a plant. He has not slept for 20 hours. Why? Because he was at work yesterday, he went home, there were problems, no money, and now he's back at work. The pressure is building up. Remember the pressure, every pressure that can, performance pressure, generation pressure, you have to meet the targets. The HOD is asleep, he can't reach him. The kid is sick, how will he get home? 38 kilometers away from work. Remember, we work at a Hellsgate Park. You cannot drive beyond 40 kilometers per hour to rush home because you hit an animal. That is another stress. So I'm not just talking about this like third party, but I've experienced this. I'm working in operation department. I've been there 2 a.m. in the morning, and we did a small survey just to improve our. Lenny, come back. Come back, please. You want me to get up back? Stand there. We're there for power. So our data analysis we did basing on COPSOC data, employee testimony, and actual months of operation results. And you know, getting the 68% people to talk was very difficult. But one thing I learned is that you need to have some keyword to get people talking. For example, if you want to talk to a wealthy man and listen to what they have in their minds, just say, "He's Rekali." And they'll give you a lot of things that they are going on. So we generate 150 megawatts, 80 employees, 24/7 operation, and 41 kilometers away from the nearest town. Now, before this actually, we were doing 135 megawatts. From the small improvement, okay, it is not directly related, but since we did this small exercise, we went back to 150. That means we improved the performance of employees and the performance of the plant. So the plant was also experiencing some psychological issue because it was not being attended to well. So we work on a world-class operation, built on world-class hazards that are controlled by this man here. 2 hazards, 1 workforce. One of them is physical. That's why Lenny is here. He makes sure we don't undergo all these hazards. We have the gases, timbers, rotating machinery, and all the hazards that you can imagine in geothermal. So we have the invisible one, and so many people have talked about them, and these are the ones that we can't see. These are the ones that I can't see you then, you carrying at home. But now I can see some smiles. It's good. So we have high consequence decision in our power plants generating 150 megawatts. Any wrong decision you make can bring down the whole plant and affect the grid. And then Kenya Power will say there was a monkey on the line. But someone who has done a poor decision. Another one, rotating shifts. You are in for the night shift today, but since you have money and you have been called tomorrow, you've been in for night shift for 4 days, but since you love money and tomorrow you have been called in for a day shift and it's overtime, so you assume you are okay and then you go to work. So your sleeping clock is disrupted. That causes psychosocial problem. Social isolation, we work in a remote area. Communication gaps, very important. If the leaders are here, you have to look at this. There was problem. You share something, but before it reaches to the management who can help you, it has been pampered. Umesema unataka kila asubuhi kunywa maziwa, ukiingia kazi, ikifika huko juu imepanguzwa, unasema unafaa ukunywe chai. So mental health and stigma and silence. So many people are suffering. I think in 8 people there are 2 people who have mental health problems. Count, and you see maybe the one. So I won't talk much about this. The other presenters have mentioned them. What are the psychosocial risks? We have how we work, And actually, psychosocial affects how we work, and that's why I was saying we were doing 135 megawatts, and after doing some solution, we got to 150. That means more money. Social factors, environmental hazard, then physical ill health, mental ill health, cognitive impacts, and environmental impact. So, pressure inside the well and the pressure inside the worker. Shift work demands, we have remote site isolation, high consequence decision, then organizational pressure. You need to meet the generation. You wonder, are you going to blow the well with your mouth so that you can meet the 150 megawatts? It's not your problem, it's not performing, but the management want to see 150 megawatts. So that's mounts pressure to your head, adding on the pressure that you don't have. What if we could measure? So what did we do? We measured. Why? We sent the surveys. Those who are willing to talk, shared with us. Those who are willing to take part in the interview, what? And then we evaluated, and then we build the stuff. How? Yeah. So these were the results. How many people knew that employee assistance program existed? Only 23%. Contingent isolation, role ambiguity. You are an engineer, but you work as a receptionist. Just because you want to work. Mental health stigma was 58%. Communication gap 61%. Work-related stress was, yeah. So silent suffering was a norm, not the exception. And I want to mention there was this one person here called Festus among us. He's a very good person. He's the speaker. He really protects us. Festus, you can stand as I continue. And we have Nimtetezi. We call him the general. So three pillars. How did we work to ensure that we not completely eliminate this, but at least we improve the behavior of the people? We eliminate this social risk. One, peer support. 8 people were taken to training, and they came back to talk to people. And there's another training lined up. We'll be taking for the same safety dialogue training here quarterly to ensure that people share their issues. And then confidential EAP. Our insurance provider, that is AAI, is responsible for providing us with the EAP service providers. But apart, there are so many here. We can talk. What we actually did, I've already mentioned, peer support, and this is the data I've already mentioned. Improvement. So from psychosocial safety, it improved from 42 to 79. Engagement, at least more people talked. We knew how to make them talk. So from 52 to 74, but there are still some people who don't want to talk, but we'll get there. 23, that is EAP program, to 74. So some people knew we can call someone even at night and they talk to us confidentially without, for example, someone has kisonono. You cannot go telling everyone at work and saying kisonono. No, you need someone you trust so that you can get help. Absenteeism reduced. It was on a very high note, so it went back to 69, and then communication gap, 51 to 31. We still have some work to do. Then, of course, program did not succeed because it was elegant. We just tried. We had no training. We are just engineers. We are not psychosocial. But management were willing to listen, and they shared also their problem, and we listened. Festus, the workforce who spoke, Festus there and others. So we were able to get the information. Then whatever we need at Olkare can work at your place. Just measure, listen to people, build a structure, and do some tracking and event. Okay? Good physical, good psychosocial working environment are not luxury. So, yes. Then, just note, the workforce is already talking. The question is, are you listening? Now, I just want to give an example. That this one was in my house because I was watching Arsenal versus Manchester City, and you know I don't like Arsenal. So, and Manchester City was almost scoring, so I was there, goal! And my daughter, 3 years, was there on the seat, and she told me, "Daddy, stop making noise. I need to sleep." So you need to make an environment that the leaders and even the small person like my 3-year daughter has a voice to speak. Because ideally she's so small to speak to me like that. You know the life we live. Ungeambia mzae hivyo. Si kweli? So if we have leaders here and managers, just make sure you create an environment that allows your employees to talk, let them pass. And if we have a good psychosocial working environment, definitely there will be good results. Engele? Clap for me.
I'm just going to watch 1 minute. I'm Lenny Narukila, I'm Masai, of course. I'll just lead through about what he has just talked about. Fostering a good psychosocial within our workplace need a lot. One starts with safety. Work safety system in place with the support of the management and involvement of employees will always bring or reduce psychosocial hazard or problem within the workplace. Also training. In our workplace, we have quarterly work-life balance that we do. We do quarterly training for our employee. Also, we have wellness activity, which is led by my friend here and David. Or for our team, that is our team. Also, the wellness team is comprised of all departments within the organization. So consider all the departments, even the kitchen department. Lastly is annual employee engagement survey that we do in our place. Do you have in your place, in your organization? And how do you conduct it? Also, lastly is policy awareness that we do every week. Policy is too large and we need to do the training and awareness every week. So we have scheduled Wednesday morning for all employees. Do you do that at your organization? I hope we will go back and listen to our employees and fostering a safe, good, working social environment. That is all.
Thank you so much. Makofi kwa engineers. They've done a good job. We need to appreciate them. Wow, that was good and entertaining as well. So we really appreciate your work. Thank you so much. Somebody misplaced his or her car keys. Please, if you've lost your car keys, get in touch with Joshua Security pale nje. You will get your car keys. Allow me, before I call the next presenter, to recognize Mount Elgon Orchards, Kitale. Wanaweza simama to recognize. Thank you so much. Tuwapigie makofi. Thank you for coming. Allow me to call the next presenter, Madam Agnes. She's going to do a presentation. And Madam is also an engineer. I think today we are privileged to have so many engineers. She's a principal engineer. She looks into quality, safety. She has 13 years of experience in KenGen. Oh, sorry, in energy sector. And she's actually a mechanical engineer. So, karibu sana engineer to pay presentation. Thank you.
Thank you very much, Dr. As you said, I'm Agnes Mainye. Unfortunately, I didn't bring a support system, but I believe I have a lot of KenGen team in the crowd who are my support system, and many other colleagues in my previous employment. Of course, today we're looking at psychosocial issues at the workplace. My topic is mitigating psychosocial risks in lone working. Most of what I'm going to present, actually it seems we are in sync with most of us, most of the team, and we will look at how they have covered it. And of course, focus is in the energy sector because that is where I've worked all my life, and that is the experience I'm going to use to bring. So we're going to try and understand what is lone working in the energy sector. And as I said, this scenario is almost similar to what Godfrey has brought to us. And this is where my problem statement comes from. You picture a technician working in a remote site, in a geothermal site. As you're aware, in KenGen, we are vast in the energy sector. We have the hydropower plants, we have the thermal power plants, solar, and so many other. And at 2 a.m., we have an alarm that rings. And of course, this person is alone in the site, and there's no immediate support. What do you think will happen to this colleague? He is alone. I'm sure from Friday, Saturday, we have engaged our teams in first aid competition, fire safety competitions, and I don't think we exposed any of them to lone working because they had to work as a team. But then we are in a power plant where there is an emergency, this person is working alone. And that is where our problems comes from as lone workers. So of course lone working is where an employee is working without supervision or without anyone to assist them. And this is common in the energy sector, in the geothermal fields, hydroelectric tunnels, powerhouses, substations, and isolated control rooms. And some of the tasks they take alone include routine inspections, equipment monitoring, maintenance, troubleshooting, and much, much more. And these workers, of course, they're exposed to various hazards while they are working alone. And therefore, we're going to look at the psychosocial hazards associated with lone working. And of course, one of them is high job demand and limited support. They have this pressure that Godfrey kept talking about. They have to meet the demands of the employer. And they don't have any support to do this. And what does this do to them? They have complex tasks that they have to think, and at that time you're just trying to wonder how are you going to deal with these tasks that you've been given. And therefore, we have also cognitive load, where you have a lot of load. You're wondering, I need to move this from this point, I need to do that, I need to do that within the time frame you're working. And of course, this increases the mental fatigue and also increases the errors that we can make. I heard one of us saying that in the workplace, psychosocial issues also bring errors in our work. Some of the problems we've had in the workplace are caused by lone working. And also we have social isolation that also Godfrey was talking about, because constantly you're working alone, and with time you start feeling isolated socially. You have no one to talk to, no one to reach out to, no one to consult with, and the scenario given at 2 a.m., you can't call your supervisor at that time to ask them for guidance in anything. And also the issue of fatigue and emergency anxiety. So just like I've explained, you are having an emergency, you are alone, then fatigue, bodily fatigue, physical fatigue comes in. In an emergency, you're not able to, make those decisions, those very quick decisions that are required to ensure that you attend to all emergency situations. And so many other, just like poor communication, because then you have no one to talk to, unclear roles, and some of also the hazards that come with lone working. Because sometimes you have too much, and especially in our workplaces in the energy sector, we have all the workforce between 8 and 5. But after 5 or before 8, we have lean workforce. All these tasks, at that time you have to play HR, you have to play the MD, you have to play the psychological, and the psychologist. You have to play so many roles for you to meet your obligations after 5 and before 8 a.m. And of course, that brings in the unclear roles. And these ones are never included even in your JD. So what is the impact on safety, performance, and resilience? And one of them is the risk of unmanaged psychosocial factors. We have so many issues that crop up, and no one is realizing all these issues, and therefore no one is managing them. Also, we have organizational consequences. We have increased incidents, yes? Especially during when we have lone working. But there, as we said, more errors are likely to occur. Even if the incident, both operational and safety, even if it occurs way after this lone working, even if it's normal working, sometimes it's because of the error that somebody who was working in a lone working environment caused. But then, we also have benefits of managing psychosocial issues. And that is proactive management enhances psychological safety, employee engagement, and trust between workers. And of course, it improves the work relation. Also, it will improve to resilience and safety culture. Because of course, if we manage psychosocial issues, then we anticipate that our safety culture, our resilience as organizations will definitely improve. And therefore, as organizations, we have to look at the strategic importance of psychosocial risk management. And of course, as organizations, we come year in, year out, we set objectives, we say, where do we want to go in the next 5 years, in the next 10 years, but then we forget the worker. Just like the panelists were saying, we forget the human aspect. How are we going to invest more in this employee who keeps giving us? Because the employee is the person we need to invest more, because they're the ones coming in with knowledge, coming in with all this technology, coming in with even AI was not built by itself. It was built by an employee. Therefore, if we invest in our employees, then it is also a strategic outlook. We need to have it in our mind in the strategic outlook of the organization to enjoy long-term benefits. And by that also, we also look at strategic risk management. And one of our key standards, even as Kengen, we've implemented ISO 45001. It is good that as an organization, we also, for many of us, for other organizations, we implement this standard because also they give us a guidance as an organization on how to manage psychosocial issues. And ISO 45003 is the first international standard giving guidance on psychosocial issues and mental health. And therefore, if we embrace these standards as organizations, then definitely we are going to address our psychosocial risks in a better way. Also stakeholder engagement, because effective psychosocial risk mitigation requires leadership, system controls, regulatory support across all multiple stakeholders. And therefore, we all have to come together to see how we are going to implement this at the strategy level. And some of the objectives and methodology and interventions we can take include this issue. What I didn't say in the beginning is that this issue of psychosocial, and why for me I took it seriously was during an audit, an internal audit that we were having in our organization. And as we said, where they exist loan working includes our workers work at the tunnel. And during our safety audit, this came out that an employee said, during an interview, an employee said that when they are working under the tunnel, most of the time at night they are alone. Under the tunnel, several feet, several meters below the ground, they are working alone. When they're working alone, they start hearing sounds in the engine room. Yes? So when they see sounds or even they see people, when they go there is no one. When they go to look at what is the issue, they can't see anything. So they're seeing ghosts. That is what they say. They're seeing ghosts. And one of them even indicated that a fellow colleague was not well because of similar issues. And for me, that really left me wondering, what can we do? And one of the ways we can do, because we've not carried out a study, but one of the things we can do is to boost our well-being and support organizational goals. When it comes to, even as we have a psychologist, maybe we've not carried out psychosocial issues related to risk assessment. And some of the ways we can do is to do a psychosocial risk assessment. I like Dr. Melanie said something about the risk, when they looked at the risk assessment that have been submitted through the DOSHS, they didn't see any issue related to psychosocial risk assessment. And of course, this is a gap we have, because, and that is why I was saying, the template that we have, even from the regulator, does not give room for this. But as organizations, as regulators, what can we do? We need to do focused psychosocial risk assessment, employee surveys, interviews, and gather comprehensive data related to loan working. Also, we can assess our incidents, and this one of our speakers in the panel also indicated this. We can assess incident analysis and audits. We can carry out target incident analysis and see, could some of these near misses, accidents, and several other incidents be caused by loan working? And also we can benchmark best practices internationally. We can benchmark with ILO, we can benchmark with the standards that we have against ISO 45001 and see how best can we manage these issues of psychosocial at the workplace. To move in, I don't know. So, some of the proposed interventions for psychosocial risk mitigation include system-level intervention. This is where we come with procedures, communication protocols for people who are working in loan environment. Do we have in our workplaces, when we look at all our procedures, all our safety procedures, focused on the physical safety, but we don't have procedures related to certain environments like loan working? Do we have communication protocols? Is this employee being left alone to deal with issues of emergencies alone? Or can employ digital monitoring technologies? I love the presenters who came, the first presenters also from Kengen. They talked about UAV. And this is one of the ways we can also use to check in our employees who are doing loan working. Sometimes, yes, we cannot prevent, we cannot avoid entirely loan working, but then we can employ digital ways to assess and manage our employees who are in loan working environment. Because as also our panel they were saying, when we come with technology, is it just to monitor, or is it to help our employees know that there is somebody there for them? In case of anything, in case this person fails, will somebody be able to reach out to them, for example? If they send in a panic button, will somebody respond? And these are some of the programs we can use to employ some of these tools to ensure that our workers feel safe even if they're carrying out a task by themselves. Also, we can do job and shift design. We can redesign our work in a way that those risky jobs, those high demanding jobs will not be done by a lone worker. They can be done during the day when we have more workforce, but the lone workers just handle those key, very small tasks and only emergency issues. And also just limiting lone working altogether. Yeah? It can be an option. Also, leadership commitment. Are our leaders coming out and speaking on behalf of psychosocial issues? What is their commitment? What is our commitment as leaders in the organization on matters psychosocial? Maybe could be out. Move to the next. So some of the results and organizational benefits we would expect is an improved worker well-being. And of course, through psychosocial support forums, through all the other interventions that we've talked about, this employee will feel more confident to come to work every other day. We'll have less absenteeism at work. And that means even the employee, is psyched up for work, and we don't have cases of reduced morale. Also, we will have enhanced safety performance. As we say, incident rates will go down. We will be able to deal with emergencies in a better way. Of course, with the employment of technologies such as the UAV, we'll have better responses to emergency, and of course, the reduced impact on our organization. And generally, we'll have organizational benefits, as you said, reduced absenteeism, higher engagement, more productivity. Even as my predecessors talked about, there was higher productivity in the organization. And we've seen as an example of that organization where they were doing 135 megawatts and it improved to 150. And also we will have better alignment to the international standards that we prescribe to. And even if we don't prescribe to them, it's still a way to benchmark, as we say, that we can benchmark with these standards and we can improve our overall performance. And finally, we're going to look at the regulatory and policy implications. What does this mean for our regulations and the policy implications? Thank you, Abel Ringer. I'm on my last slide. Some of the key takeaways and policy recommendations include recognizing psychosocial risks and embedding this in our design, which has come out more clearly. More organizations emphasis when it comes to risk assessment is on the physical hazards. But let us be more focused on let us include psychosocial issues in our risk assessment. Also, let us recognize that lone working poses challenges to psychosocial issues. Some of the things that we can do to improve that. Also, policy recommendations as organizations, as the regulator, as stakeholders. What policies are we coming up with? Are we developing policies that can help improve psychosocial issues? And overall, let us strengthen our occupational health and safety system, both at the workplace, at the sector, and definitely as a country will do better in terms of psychosocial issues. I come to the end of my presentation. Thank you.
Thank you so much, Engineer Agnes. Makofi tena kwake. That was so good. We really appreciate your work. Thank you so much. I'm told that I have not recognized some people. Allow me to recognize Kemri. Kemri, I've been told Kemri will go around. So we appreciate your presence, Kemri. I'm also being accused that I have not recognized DOSHS. Imagine. And I've been asked to ask all the DOSHS staff to stand so that you can see them and you clap for them. Please, if you are from DOSHS, you can stand. All represented, eh? Very good. That is so good. Thank you so much for accepting to stand, and my apologies for not recognizing you well in time. So we want to call the next presenter. She's Professor Fanny Wangela Feather. She's a professor of chemistry and a director of gender and development at the University of Kabianga. And she has contributed significantly to environmental research and curriculum development She is also taking charge right now of the Office of the Deputy Vice Chancellor of Academics and Students Affairs. To clap for the professor as she comes in. Karibu sana Professor. I want to give you the mic utuelimishe. Thank you.
I'm told it's an afternoon. Good afternoon. I saw some slides if I came here, and I don't know why you are reading my mind. Sometimes we need to just make a smile to the next person around us, right? So pick your phone. Pick your phone. Look at the person on your right, into the face. Another one on the right, on the left, look at them. Try the one at the back. Try the one in front. Ni ngumu, si ndio? Si ni ngumu? Hii psychosocial maneno this. Take a snap. Inaitwa aje? A selfie. With one of those that you found a smile on. Take a smile and tell her it is DOSHS. And just post. We were told to post. You didn't see that? Please put the hashtag again. We need to know that we are here for a conference, right? You can post. Right? Kama nikataa kuchukua selfie leo achana tuna yeye. Now maybe it is time to ask ourselves where we came from, how was it? Probably we have carried others from where we were, right? To our workplace. Thank you. So I'll be speaking to us briefly. Actually, I came to do some learnings and unlearning. Sometimes we learn in different environments and think we know. And then you move to another environment and you think you did not know. So quite a lot of times, from where I come from, I have learned in life that we need to learn and unlearn. I want to talk about integration of psychosocial risk into DOSHS management systems. I have an orientation on the aspect of gender. Probably because of what I am doing at the university for the last 6 years, I have been working to mainstream gender. I like the presenters who have come before me, and I have learned quite a lot from them as well. But all along, I've been asking myself one question, and maybe that is the reason why I chose to speak today. How about this isolation at the energy sector? Imagine you, the gent, you are in that desert, it's not a desert, right? You are seeing an animal crossing, so you have to stop. In a similar measure, that lady also has to see that and has to stop. It is at 2 a.m. in the morning. And again, I'm imagining this lady is also trying, with those 40 kilometers per hour, she's also trying to rush home because she has to go and breastfeed. And besides that, the man is in the house, he has to go to work. Before she settles down to say, may I take a nap? When we talk about these psychosocial issues then, I relate with this and I'm asking myself, so how does it impact across gender? And then I was also asking myself, I love the presentation that was made for geothermal. And I looked through and I said, they have made a state. And I was asking myself, actually this is a review, it's not a research. I was doing a review of works that have been done. And that's how I at this issue of gender. And I was asking myself, so, if the performance improved from whatever percentage to whatever percentage, I want to imagine the ladies who made the performance go up. But I'm not even hearing the men complain. They're even clapping for us. Don't you think we are being selfish? And you know, this is how it portrays itself at our workplaces. And then we become so mean, and our meanness generates into something else. And then we get stressed. And then I say so and so is not good. Sindio? Many words we use. At the end of it all, there's a rift. That rift progresses even into leadership, even into our organizational structure. They design the way we do work. And then, of course, we want to prevent it. But the question is, do we look at how gendered it is amongst us? If we want to start that, maybe the next slide now that this is not working. And so I looked at a 10-year span. What has happened through and through? When we are talking about DOSHS, we are talking about ISO 43003, we are talking about 001, we are talking about ILO, and all this. What really has happened? So there has been a shift. If you look at it from a workplace point of view, there has been a shift. At first it was voluntary. Now it's compulsory. You must do this audit. In the very beginning, I looked at it in 4 phases. In the very beginning, it was voluntary. Nobody pushed you to audit on psychosocial matters. Leave alone gender. Leave alone mental health. It was voluntary. And I think those companies or organizations which started with voluntary work on this may have made us right. Probably that would be another review that I've been doing. For those who did it voluntarily, where are they today, you know, in respect of the others who have been compelled to do it? And so, there is even a point where they went into the gender disaggregated data. But when I was looking at all the works that have been done, I actually tried to look for this disaggregated data. Much of it is about male and female. But disaggregated data goes beyond male and female. I am sure if we look around ourselves, it is beyond just a male and female. There is youth under 35, there's the age over 35, there is a PWD, and even under the PWD, there are different categories of PWDs. So that if I am looking at this psychosocial impact, I am auditing it. I am looking at this person who has a special need, probably they are on a wheelchair. And I'm looking at this one who cannot even read. I'm looking at this one who can't even hear. When we are doing this psychosocial audit, do we look at it wholesomely? When we say we are providing disaggregated data, is it wholesome? That's what prompted me to look at this. Fine. And so there was enforcement data that came in through 2024, the DOSHS 2026, and all that. So I looked at in Kenya, you know, if you look at what is happening within our organizations, previously, all this would be referred to HR. HR. Mental issues, HR. But what is happening now? Who are leading this wellness? Is it just HR-led wellness? It is OSH-led compliance. So meaning there's a big shift. Much as there is an interrelationship, and I liked the presenters who are here, one of them said, why do we have to come to the level of where now we have to surcharge? We have gone through prevention. If it doesn't work, what else? But why can't we move from the very previous and find what another member here was asking, what are the signs? Why don't we look at those signs and prevent them before we can go to court? So evidence remains concentrated. For example, if you look at what is happening now, you'll find large companies are really aligning. But what of those that have informal sectors? What is happening there? Next slide. So there are those 4 phases. Phase 1, 2016 to 2018, what happened? The wellness era. From 2019 to 2021, second phase, the tipping point, where of course the ILO C190 was adopted. And if you look at this, in the first one, they were saying we are gender blind. Nobody bothered whether you're male or female. It was just, is it happening? In the second case, where we were adopting this, and it was published, COVID forced us to look at things differently from what was happening at home and work hazards, and how were they overlapping. There was a shift. In 2022, 2024, now we come in with standardizations. We're asking, how is it like? 34% were for no cohort data. And when I was going through several papers, it was telling me at some point, even those who are funding now would not fund without a gender lens. All right? And even if you reported there was 0, it was not acceptable. So the fourth phase, in the next slide, kindly, 2025 to 2026, serious enforcement. And that's why we are here today. We are here to look at what is happening around us, to benchmark from each other, to share information. And I like the presenters that have come. All along we are talking about capacity building, leadership, and all that. And so the trend is simple, that we regulators, or the regulators, learn to ask which workers, and not just what hazard. But we need to move away from just which workers, to say which workers of which category, of which age, of which diversity, of which, are we very inclusive in what we are doing? Next slide, please. And so those were the drivers I thought I found. The 4 documents that changed everything. All right? From psychosocial health at work, we are talking about gender-based violence, we are talking about mental health, we are talking about inspectors of psychosocial hazards, and I am sure amongst us we have even more than we can add on this. Ideally, we have made steps that are very impactful to our organizations. I look at what we are discussing today and I revert back to where I come from. And I am asking myself, 3 things are very key. Maybe the next slide. Next slide. I was asking myself, so which is the next document? From the gaps that we are identifying, from our assessments that we are doing, what are they now addressing? So what is this that we are now going to come up with again? So we need to look at all the gaps that are existing. And that's why today we are talking about psychosocial issues. Because it was found to be a gap. Initially we were talking about mental health. Productivity has gone down because people have mental issues, and people are becoming suicidal. And so why are they becoming suicidal? Because they have psychosocial impacts in their lives. So this is where we are. I like this. The gender lens, wide segregation. Data became compliance. If you look at research that has been done between 2026 to 2027, it confirms a differential exposure. And when I looked at this, I related with what happened down where I work, the T sector. But they have learned to unlearn. That's what I said. I started there. Much as we are saying 3 things are very key. The design of the work, how it cuts across all these gendered aspects. Number 2, how is it organized across all those gendered aspects? And number 3, the management. Right? 3 things that are very key when we talk about psychosocial factors. And so I looked at one of those T firms when I was perusing through documents. And it says A moment in 2022, they reported 0 psychosocial hazard. 0. But then, at some point again, I read another one, it said, 1, they reported 42% for female and 5% for male going through sexual and gender-based violence. And now my question would be, Madam, 42% is it the young, is it the old ladies, is it the mid-age, is it the PWD, or which group is this? Again, is it those who have come from very far to work within the diversity aspect? Probably we are being sidelined. And that's why I am facing more of this psychosocial risk as compared to you because you are from that area. Why? Because in my area, we have normalized beating, right? And so if I'm beaten, I find that strange. But because you have come to live among us and you are beaten, it is strange to you. It makes you get sick. Psychosocially, you are unstable. You bring it to work, your productivity goes down. Culture has made me to normalize certain things. So now here is the challenge. We are talking about design. How does design intertwine with culture? I was in a conference in Turkana the other day, and I was with a younger lady. She was younger than me. There's a swimming pool, and we are like, this place is so hot, why don't we dive into this water? And she said, you know what she said? There was this here from our region, but then not that they were related. She just said, there was this from our region, I can't go undressing and getting into the water. Culture, impact. So she lives with her stress of heat because she cannot step in the water because Mr. Nyongesa is seated close. Are we looking at this? And that's why for me, gender is very key when it comes to psychosocial matters. And to an extent, some of us have normalized it. I don't see it as a problem, but you see it as a problem. So you have a problem, me I don't have a problem. You want to change me, I see I'm okay. Why are you changing me? Are we together? Yeah. And so this, for me, makes a lot of sense. The empirical data, equity to evidence. We are talking about gender was framed as DII, diversity, equity and inclusivity. And of course, we move down and we are saying there is need to move further than just a women. Next slide, please. Wellness gave us yoga. Fine. So I feel good. When I sit there, I focus, I can only sing about, yeah? Compliance will give us job design. Right? We spoke about design, organization, and leadership. And gender data gives us the audit trail. So that we know, even as we are providing yoga, it is affecting our Dr. Nyandusi differently, and it's affecting Madam here differently. And then when they go back to work, and they need to comply because of the job design, that we can audit them separately and see how it is impacting. And so the gaps that came out between 2016 and 2026, which we are speaking about today, only 4 peer-reviewed studies from Africa on all ISO 45003 that were talking about gender. Like you can explicitly pick it out and say, under 35 this is talking, over 25, 35 this is talking, but all is talking about a female, a woman. But can we segregate them? Informal sector, 61% of global workers are in the informal. How about where it is not standardized? What happens? Maybe we need to look beyond those large companies. Male mental health. Sijui nipite tu hapo? Sinipite tu hapo? It's saying most gendered research is on women. What's happening with our male gender? And now we need to move even much deeper into looking at Gen Z, looking at Alpha. I don't know, you are calling them what? Today, if you were to sit and tell no, let me not go there. Suicide. Who among human beings face quite a lot of suicidal abuse? Male. How much research has gone to the male gender when we are talking about psychosocial risks? Yes, it has gone to the male. How much of it has gone to the youth below 35? Because tomorrow these are the people who are going to change and bring us another legislation. And then lastly, the effectiveness of all this. We can move on. So of course there are gaps, non-conformance under ISO 45003, ILO C190, exclusion of men's risks, informal workers, intersectional analysis. We are talking about absence of control, effectiveness data, and of course lack of confidentiality. I like the presenter who is having a co-presenter here, and he said, confidentiality. There was something they mentioned about confidentiality, right? That I can actually say Niko Natiso, but wewe utatoka ukoseme nilipigwa usiku. Ndio maana I'm not working very hard. But I will tell you, the TS that I was reading about, when in 2022 there was 0 psychosocial risk documented, 4 things they changed was on leadership, because they looked at some of the women supervisors, they rotated them. They also changed some of the routes which were not lit, they improved on security. There were lights, and many other issues they changed. And do you know, the research that was done showed that productivity increased. And in the very previous, when there was 0 report, data on psychosocial report, the document says women turnover was very high. When we had more reports that were done in 2024, the women turnover went down from 45% to 21%. Gendered research. It makes an improvement, even when it goes to productivity, without necessarily blanketing everything. Because we are affected differently. So this gaps risk creating a two-tier system where multinational compliant SMEs, men and informal workers remain unprotected. The next slide, I don't know if there is. So future research has it, and looked at what was being discussed here on technology. Maybe we can just go to the next slide. I have these thoughts, part of what we can think about. And this first one, I looked at it, fine, we are going to organizations, we are auditing the risks that come with psychosocial factors. And I looked at our Uber, our Bolt, our what. Isn't this not a workplace? Digital platforms. I hope we are also going to our digital platform workplaces and doing the same. So that we can also see what comes out of it. Does it affect even the commuter who is coming to work? And when she arrives at work, how she was through that digital platform workplace as she was commuting. Or that driver, for example, what happens? That's a platform where technology impacts. And then of course, the gender psychosocial controls in the tier states and other sectors. The BBC, if we were doing quite some in-depth analysis, I don't know whether this BBC would have come in at that particular time. It found a lot of us off balance. And so, my last slide, I guess. I have talked about this. Let's proceed. So this is my big question. As I look at this, and I speak from my workplace. The other day we were just launching the male dialogue. And then we also launched the female dialogue because we face different challenges at workplace. So we need to go beyond this and ask ourselves, then, do you think we have legislated enough on psychosocial issues in the workplace, especially in the wake of digital workplaces? Thank you very much.
Thank you so much, Professor. I think hiyo makofi ijatosha ya Professor. We are greatly honored to have a Deputy Vice Chancellor creating time to come and talk to us. I think that is an achievement from where we sit. So you can clap for her again. She wants to say something.
So that I don't lose my job. I have done a lot of acting as Deputy Vice Chancellor. You know, when Dr. Nyandusi is not there, he puts someone in office. So I have done that quite a lot, among many other things. And so I don't want to lose my job. Because I've been told, you say you're a Deputy Vice Chancellor, and we have Deputy Vice Chancellors. But thank you so much, because I have done it.
Thank you very much. I think we really appreciate that. Allow me to recognize the presence of a government-owned vaccine manufacturing organization called Kenya Biomax Institute. Wanaweza simama, tuwapigie makofi. Thank you very much for coming and gracing the occasion also. Before we go to the panel discussion, I want to call another presenter to present to us, one of our own, Dr. Andrew Muruka, who is a director in DOSHS. He is also an author. He has authored 2 books, one on comfort of workers, another one on biorisk management, and I am sure some of you don't know that he used to work in Kebri, Welcome Trust, as the health and safety manager. He is also the originator of a very famous phrase in DOSHS that we say, one DOSHS. Just repeat it, one DOSHS. He is the originator of that phrase. So allow me to welcome Dr. Andrew Muruka as he is coming. I also want the panelists to be ready. Karibu sana daktari. Karibu.
Thank you very much, Dr. Itanga. You have made sure that people don't listen to my presentation by giving it the last one before lunch. But all the same, we'll talk after this. I want to speak about this thing. Forgotten now, please. The first one, I want to see the first one. The first, yes, this one. Thank you very much. So, you know, I have heard about gender from Prof. So I have remembered that I need to show you my dashboard. The number of accidents pattern that have occurred in the last 2 years. And the gender of the people who have died. You know, sometimes data can speak better also sometimes. So we have 696 as of today. And all of them are males. So that brings a lot of fear to me as a thank you. So I want to propose a novel framework for classifying workplace risks using domain-based risk assessment modeling. And this risk assessment, based modeling tool, it will be able to segment occupational risk into core domain and aggregate them into structured workplace risk groups. So that what we have with the biological risk classification that we know, which we normally refer to as the risk group classification, risk group 1, risk group 2, risk group 3, and risk group 4 for biological organisms. We think that this one can be used also to align what we refer to as workplaces. So we should be able to group all workplaces using this domain-based risk assessment model tool into 4 workplace risk groups. This will facilitate appropriate strategic, operational, and comparative profiling. We're able to compare workplaces based on this modeling tool. We will be using what we refer to as both leading and lagging indicators to do this. And these indicators are what we refer to as the domains in this particular modeling. We are going to use role clarity as a perfect, measurable example in aiding psychosocial domain-based risk assessment modeling. And it has potential for further integration into a unified kind of system, the one that I'm talking about, that will generate 4 different work risk group levels. So the proposed model is based on domain-based risk assessment modeling tool, and it will focus, as I've said, on leading indicators, lagging indicators, and also emerging indicators, what other people call others. So others is what we refer to here as emerging indicators. So anything that is not found under lagging indicators, we will group them under emerging indicators. And then in this conceptual framework, we have the dependent variable, which is the workplace group. And the categories will be 1 will be workplace risk group 1, where there is low risk. It will be referred to as a low risk workplace. Then we will have moderate risk workplace. And number 3, we will have high risk workplace. Number 4, we'll have critical risk workplace. So based on these different types of risk categories, if you are a safety officer and you concentrate on this area for enforcement activities, then you are exposing workers to highly critical risk workplaces. And therefore, the work that you are doing will be of little use to the workplace. So the modeling tools are 3. The 3 options here. We have ordinal logistic regression, multinomial logistic regression, and composite weighted risk index. We used to have Professor who was very keen on weighted risk index. He used to be very keen. Professor Nyoyo, let him rest in peace, he was very keen on this one. But he died before we are able to develop how to conduct this weighted risk index analysis. Now, the independent variables are 7, and they can be as many as possible. They are grouped into these 4 main domains, as we have, 7 different types of domains, as we have indicated. So these are the domains, and these are where we are going to identify the risks. So number one is regulatory compliance indicators. And because this is a proposal, I'm going to take forward regulatory compliance indicators and give about 5 examples. So we have, the law requires that a workplace requires to undertake a risk assessment, but we know that risk assessments are live documents, and we would like to see the number. The proposed measurement here would be the number of risk assessments done by the workplace per year, depending on the risk exposure and the risk profile. We also have DOSHS inspections. I am aware that there are some workplaces that are regularly visited. A DOSHS officer will visit you 3 times, but he leaves the other neighbor there. So the number of inspections would be a good regulatory compliance indicator to help us identify the regulatory compliance level. And then we also have health and safety committee inspections and all this, and then we will have something like a level compliance score. This is an example of regulatory compliance indicators. The identified subdomains that will be included in the domain-based risk assessment model. Then we have model options. So we have 2 main model options, and these are based on the risk, index. So the first one is based on the risk index. I will not go into all this, but there will be a total risk. There will be a total risk score based on 2 items. Number 1 will be proactive indices. That is part of the leading indicators regime, and the reactive index aspect based on the lagging indicators regime. As at now, in the DOSHS system, we have about 62 variables on the proactive index regime. At the time I was preparing this paper, there were only 46. So, and the reactive index, the number of variables is about 30. The second option for our modeling is ordinal logistic regression model. This is a legit kind of regression analysis, and this one has the capability to predict where your workplace will fall. It can tell you this is a low, work risk group, workplace risk group 1 or workplace risk group 3. So this model has that capability. I want to add that between these 2 models, artificial intelligence modeling can be enhanced, can be used to enhance this one. Don't tell me whether I know how to use it, but it can be used to do this. We have tech companies that are able to assist this one. So, if we use scoring, we use the risk scoring, a score of 80 and above would be a low risk. And then when we have 60 to 79, that will be moderate risk. 80 and above, I don't know, it's A plain, A plus or something. So if you get an A, you are low risk workplace. If you get less than 40 as a workplace, there is critical risk. And probably this should be, if you are in a county and you are auditing, this should be your focus for auditing. If you are inspecting, this should be a major focus for inspections. Was followed by workplace risk group 3. Now, I have given an example of role clarity. You had the engineer who's working as a receptionist. So, this is one of the psychosocial risks. Role clarity. Role clarity risk emanates from, of course, it is the degree to which individuals feel they have clear guidance and available information about their roles and how they need to behave with their job, and of course how their role interacts with other teams. I think I've requested Irene to be my support. Are you coming? Or you want a volunteer? All right. So there are 5 subdomains of role clarity. Number 1 is on the issue of clarity of duties. Number 2, goals and performance expectations, authority and decision making, reporting relationships, communication, and updates. So the number 1 is about whether I know my duty well. Number 2 is on whether I know the expected performance outputs. Number 3, whether I can sign for 10 million if I am an authority to guide expense. And my boss will tell me, no, this one you cannot sign. This one you can sign. So number 4 is reporting relation. Whom do I report to, and how do these reports, and how are they supposed to be done? And then of course this. So this is one example of psychosocial risk that we can do assessment. So we are going to choose only one. We are going to choose clarity of duties. I have left out all this. Clarity of duties, we have 3 main questions that we can ask ourselves. Number 1 is, I clearly understand my responsibilities. I must be able to clearly understand my responsibilities. Number 2, after understanding my responsibilities, I should be able to clearly understand a well-defined daily task. What am I expected to be doing every day? Do I understand them? Okay? And on a Likert scale of 5, we should be able to place each and every individual. Of course, the other one is I know what is expected of me at work. And this is very important because some people go to work but they don't know what they are going to do on that particular day. So you see them moving from one office to another, or going to sit in one of the offices which are busy, where they can greet people and all this. So these subdomains allow us to know what is exactly expected of me every particular day, every day, so that I don't go to work. My workplace is a place to go and work. That's why it's called a workplace. So this, we can use this rating scale. This is the Likert rating scale to deal with all these 3 aspects of this subdomain that we are calling clarity of duties. Now, then, once we get our results, we can also look at the average scores. And once we have this average scores, we can say 4.1 to 5 is excellent, and this is where the role of the individual is very clear to the individual. You know, your role can be clear to your supervisor, but it is not clear to yourself. So you will be doing things that you are not supposed to do. Okay? We can also have 3.1 to 4. This is good rating, and this is where we will say that minor gaps exist. Yani, kuna vitu ambayo inaweza kidogo yourself. And then we have 2.1 to 3. This is moderate risk. There is noticeable confusion. This is where you find, for example, that two people are struggling to do one task. Okay? And then where you report the result after you've done it. And you know, if you don't want a task to be done, you give it to two people. Then they will be struggling, and then there will be no result. Now, the last one, which is very critical, is where we have serious role ambiguity, and this is a high-risk place. I want to tell you the good news that this tool, this domain-based risk assessment tool can be embedded in enterprises. Enterprises can have, and then the individuals can regularly update their issues to do with all the domains of role, clarity. These are the domains, all of them. So all these are domains that can be assessed on a regular basis, and from this, the workplace is able to know the areas which require improvement or attention. Now, there are certain indicative outcomes based on the average scores. For example, 2 to 3, these are self-full, frustrated employees. There is conflict between employees, errors and productivity. There are many errors and productivity is threatened. And then when you come to a score of this, then we could be thinking about an occupational disease that is actually compensable. Compensable. Now, to improve our psychosocial risk assessment model, we can combine the scale that I've talked about with interviews and document review, and these can also be embedded within the system and also in the DOSHS system. So once workplaces or once employees, because stress is individual, stress is not company, not a company gets stressed. So I think the other one that we were told about was also stress, the one by soul. So we can combine this, and this document that requires to be reviewed and be standardized. Then these results can be disaggregated by gender. This one responds to the issue of gender. Very important, because this role clarity, it may, for example, vary between males and females. You know, sometimes if you have male and female employees, you can decide to give both of them a task to do, and then it results in some ambiguity and of course stress related to the job. So these ones can also be, and learning from professor, we can also disaggregate this by age, because people experience these issues at different age and of course job categories, and then we can track these things over time. So this will be the final workplace risk groups. There will be 4, just like we have 4 in the risk groups. And then, what will be the benefit of all these domain-based risk assessment models? Number 1, it can also facilitate assessment for national occupational safety and health awards that we'll be having tomorrow. It can facilitate this one so that it can lead to automatic grouping and grading of workplaces. So you don't have to struggle going to do some safety audits here and there. This system, once embedded from the workplace to the DOSHS, it should be able to deal with that. Then it will lead to focused enforcement. People will not be going to places there. You will have the names of the workplaces with high psychosocial risk, and you will have the data of psychosocial risk that needs to be addressed. It will lead to improved workplace level risk management, because managers and supervisors at the workplace level will be able to identify the areas, the gender, the ages that require attention. And of course, it will lead to improved identification and management of psychosocial risks, especially at individual level. It is most important to identify psychosocial risks at the individual level. And of course, this is the best place, this is better, and this is good place to do this thing. And then of course, as I've said, it will improve comparability between individuals in our workplace, and also between different enterprises, and also different sectors at the national, regional, and of course global level. So thank you very much. God bless you for listening.
Thank you so much, Daktari, for that. Hiyo makofi haijatosha, please. No, he's my senior, so thank you so much, Dr. Andrew Muruka, for that. It was a bit complex, but tumeelewa. Just know tumeelewa. You can imagine me saying it was complex, eh? On a later note though. Allow me to just remind you that Professor is also an author. I forgot to mention that. Professor is an author. She has done 2 books. There's one book on research method in STEM. I'm sure you are aware nowadays we're talking about the various pathways. One of them is STEM. So you can see her after this. There is also another book she has done. And the book is on family relationships and the church. So a very good book. So I would invite you during the tea break to have a look at these 2 books. That would be good for all of us. I was asking about the health break. I am still waiting for the report, but I've been told before I get the report, if you still have a bit of energy, I can invite one more presenter. That is what I have been informed, that I can invite one more presenter. And I think silence means it is okay. Oh, there's something else I've forgotten. Being told that all the presentations will be shared. Somebody is doing, is creating a QR code that will be shared here so that you can get the presentation. Is that okay? So that will be okay. So allow me to recognize the Acting Director, Electricity and Renewable Energy, Engineer Boniface Kenenjui. Maybe you can stand, we can appreciate you. Engineer, are you around? Engineer Mendaudi? Or I can stand on his behalf. So you can clap for me. Madenge, the energy levels are low from the conversation that I've gotten. And I want you to look at the timetable, because in the afternoon, therefore, it will be easier for all of us. It's a bit easier. So I think we need Bishop. Can we then move the panel discussion to afternoon? Can we also push the presenter to afternoon? Very good. So I am seeing Mr. Wajitu, Simon Madenge is coming to give us the feedback that I had earlier requested him. So Bwana Wajitu, kuja utupe feedback. Well, I love the way he's communicating the news. He's so open, you know, like coming and telling me that lunch is not ready. I thought he would spice it up, that, and start giving me stories, you know, but that is how he has communicated, that lunch is not ready, and therefore, I want to request you. We do panel discussion, and so that in the afternoon when we come, it will be presentation of awards. So we'll have finished. Does that make sense? Yes. By the way, that is my addition. He didn't tell me that. He didn't tell me to say that, but I think that is what. So Vivian, I think I can request you. Then Vivian and Philip, you can come so that we can have panel discussion. But I don't want to stop anybody from going for a short break, a minute or two, as the panelists come here. So we are having Dr. We'll also have Professor. Then we'll have, let me just confirm, we'll have Modezi. Modezi is also there. I want to make sure I got it right. And we have Kevin Harris. So we can have those panelists coming here so that we finish and go for lunch and break.
Thank you. So we just do the 6. Yeah, so yeah, thank you, Dr. We were looking for you. Dr. Thank you. So our panelists are here. An interesting discussion. Sorry for those who do not know me, I'm Philip Wambulu, the founding president of WASPAC. WASPAC is a Workplace Safety Professional Association of Kenya, where we are calling all those interested with occupational safety, please join us so that we speak one voice. When I say safe way, you say light way. Safe way? Light way. that is the way. Vice versa is not true. Your right way is your right way, but your safe way is very good. Thank you. Okay, please do. Thank you. Vivian tries to settle the panelists. So the last presenter, Professor, talked about us thinking about workers who are not formally employed, them that we call gig workers. And I don't know by show of hands how many of us here are employed and they desire to leave employment to start their own business, whatever that they could do. How many of us are desiring, a few, I can see the numbers is rising. Very good, yes. Yes, and thank you so much. And there is one who was very happy employed, I don't know how many years, but for some of us who employed 7 years, we are desiring to move to that world. So in this discussion, our focus is on contractors, those contractual workers in our workplaces, and the gig workers. When we talk about gig workers, example, let's involve us, example of gig workers. How many came with taxi this morning? Isn't it? Yes. Those freelancer, freelancer, researchers, writers, and all that. Consultants, you're also there. You plan your work and you do every other thing. So we are talking about those contractors, and we are talking about contracted workers at our workplaces and the gig workers. And we just want to discuss this afternoon how can we ensure these workers are not left behind in psychosocial protection, and what does a truly inclusive work environment look for them? How can we build a truly work environment that takes care about the psychosocial hazards for these workers? And me, I have Dr. Andrew Muruka, who is Mumai. Say hi.
Good afternoon, everyone.
Yes, thank you. Thank you. Dr. Andrew has spoken to us. We also have our Professor Wagila. Kindly just say hi.
Hi, everyone.
Thank you. We also have Mudeisi. Please, hi.
Hi, everyone.
Great. And we also have Kevin Harris. Hi. Thank you. Thank you very much. So let's start from the gurus in the field, from legal perspective, the policy makers. And Dr. Andrew, we are talking about gig workers, these contracted workers that we also bring them in our workplaces. And my first question to you would be, from a policy and systems perspective, where are the biggest gaps in protecting these workers in terms of psychosocial well-being? Think about the taxi driver, the freelancer. Where do you think we have gaps from policy and legal framework?
Thank you very much for that particular question. The question actually reminds me of a publication by the International Labour Organization in 1961. And one of the things that was quoted in that publication is that for a very long time, in the 1800s and 1900s, children were the ones that were going to work. And they were working without any protection. They were unknown at all. They were not known by anybody. They worked more than 14 to 16, 17 hours every day, and they walked long distances every day. In most cases, they were working without proper clothing. there are residences who are not of quality, and there were children. So the gig workers, as at now, although we know that arrangements are being made, but as we speak now, we don't know their numbers. Nobody knows them by name. Nobody knows their employers, to be specific. They also don't know sometimes their employers. They know they have a platform, for example, the workers, but they are not sure of anything that they need to do with respect to timelines, how long they need to work. The workload itself is unpredictable, and generally, these are workers that are not registered. They are not in any official government publication. So the first thing that needs to be done is to ensure that at the policy level, we refer to a way or find a way by which they or this type of group of workers can be reached. They must be reached, first of all. They must be well documented. So in terms of policy, we must have a system where we can have automatic registration of these workers. And we should be able to have also a system that is able to identify where they work, their working conditions, number of working hours, which doctors, for example, they visit, what are the main complaints about these workers. If we are able to do that, we should be able to come up with a risk profile for these particular workers. So we should move, in terms of policy, we should move from what we call employment-based protection system to a risk-based protection system, where employees are considered in terms of the risk that they are exposed to and not of the nature of the contracts that they have.
Yes. Yeah. Thank you so much. Very, very key, strong points. Thank you, Daktari. Let's go to Andrew. Let me go to Kevin. Kevin. And Kevin, we are looking from employer perspective. Employers who uses contractors, who uses some of these gig workers, and we're just looking at with so much of your service delivery happening through contractors. To what extent should companies like Safaricom embed psychosocial well-being standards into procurement, and then how do you enforce this without really compromising cost and quality?
Thank you very much for that question. Maybe I may like to leave it a little bit and say that when it comes to the design of for instance, when it comes to procurement, actually is what shapes what we are talking about. Why am I saying this? It's through the procurement regime where we set SLAs. It's through the procurement where we put some number that if you don't do this, definitely some penalty are going to come your way, right? So when it comes to procurement, we as a Safaricom studied from that particular reason. How did we look at it? How can we just be proactive, employ what we call management that is proactive, and it has a positive intent when it comes to our contractors? Because we believe that majority of people who work on our space, all of us understand Safaricom, and people who run here and there, make sure that you are always connected. I am for information team, you'll note that majority of people who make us to have internet or service are people who are, let's say, age from 24 to a maximum of 28. So these are some of the people who are still trying to experience the network. They have that move and boost to go outside there and try to do things that it doesn't have a clear guidance and management. So as a company, we started by looking at the procurement regime, and the most important thing that we looked at is the policy framework. I'm saying this because majority of us who have tried even to be with us as Safaricom, you see the way sometimes it's hard because of the stringent measures that we put on matters, psychosocial management. We are pushing all high-risk organizations to have ISO 45 before you work with us. I'm saying this because somebody like me, I'm managing up to 36 contractors and a maximum of 2,000 gig workers, people who go up and about to make sure that we have provision. So you can see if we don't have good mechanism and management in that particular space is going to be hard. So in a nutshell, what are we doing as far as procurement? First is to make sure that any contractor who's coming on our space, they have ISO 45003 going forward, so that at least we can see that they're managing that space very well. Secondly, we will initiate what we call safety by design. Before we do any project in our ecosystem, it must pass through health and safety team for us to check what are some of the requirements that this particular scope of work is going to meet, so that at least we can add the aspect of social and wellness in social power and well-being in it, so that at the end of the day we can go for 100% safe. Just to close, the issue of cost, I think, is overrated when it comes to the health of our people. I normally say and advise our people, as we continue to run business, there's what we call HR, high reliability organization. How do we build our SMEs to have that particular aspect, so that when they come into this particular engagement with a company like Safaricom that is dealing with high risk work, their workforce is safe. So those two things are what we are doing to make sure that we put clusters and abstracts in the contract that protects our people.
Thank you. Thank you. Very good practical insights that you're implementing. Let's go to Madam Daisy and just a discussion on some of the interventions or framework that practically can be adopted for us to be able to manage psychosocial risks among such workers. Whether you have such in mind, discuss with us, please.
Good afternoon. My name is Daisy Kihima. Let's just think of it. I think Harnessy works for Safaricom Hub Systems. But I want you to envisage the contractor that is working for Safaricom and is also working for Daisy and others. I don't have systems, so he can only be managed from Harry's side because the system in themselves is controlling that. Remember, this is one person, probably he's servicing, let me say, your aquariums. I see Safaricom has good aquariums that they're displaying. So he does some for us, home users, and then he does some for Safaricom. Safaricom will require him to do all that he has said. Yet, us who are probably the main not main customers, but very small, many customers from one person. So I am painting this picture to tell you, if we don't have systems in place for these contractors and gig workers, we tend to have psychosocial stress because, number one, he has limited workforce. So if he has a contract with me, he has a contract with Safaricom, there is no one who is manning him in between his contract. So today they will sleep in Safaricom, do the servicing at night, and then tomorrow they will walk into my home and do several. You see, this person, no system in place. So what I'm trying to say is, we need, number one, we need to adopt the traditional method, the framework that is already there. But even as we do this, I would want big brothers like Safaricom. If there is a way in which you're able to get how many activities do they do. Because the same workers that are coming to work for you will be the same workers that will work for me. And then the balance that we are talking about, work-life balance, is missing. And you're saying if this thing is prolonged for a long time, and the way our economy is and the way the world is going, we are ending more into either contractual, subcontractual, or gig works. So let me now go back to frameworks. I'm calling upon all stakeholders. Safaricom is doing good, but those unconventional stakeholders, what can we adopt in a way that we come up with a system that we're able to monitor so that our young men that are working for these unregistered contractors are able also to get the health break that we are talking about so that we don't have these issues coming up at our workplace. Remember, we have long working hours, we have short time delivery even as we do whatever we are doing. We also have lack of social aspect in it. So it's a conversation that I'm believing we need to adopt so that even as we register, as a directorate, even as we continue to inspect these workplaces and have them come on board, also those that are not in the regulatory, you can come up with frameworks that can help us to be able to. So it's a continuous conversation we are having. We adopt the already established framework, and then we are able to tailor-make. Because right now we are moving from the conventional spaces where we used to have contractors wanasimama pale, contractor anasimama anasema niko na, I have the men at work. If is a site engineer or the foreman, he just stands and say, today I want 30 young men to come and do the work. Tomorrow they are not there. And then now we are moving from the conventional method to virtual spaces where we have faceless contractors. All that is in between us is an app. So someone is working for someone, they don't know, and then even how to follow it up. So legal framework, policy, I'm glad even there are people from Parliament here, so that we also are able to protect our young men and women.
Thank you. So just before I go back to, again to Professor, Kevin, I want you to help us to understand, if we get it right, to include these contractors and gig workers, what do you see in the next 5 years, healthy psychosocial workplace to be for them? Just bring it, highlight what would encompass a healthy psychosocial workplace for these gig and contractors workers?
Actually, that's a good question. So I'm seeing a situation whereby maybe I can give you a small history. Before I joined Safaricom, that ecosystem was not aligned in a way that was supposed to be aligned, especially when the gig workers were involved. Each and every time when we change the design, and I can tell you, team, it will be harder and harder. Why am I saying this? The more we come out with different designs technologically, and the mode of doing business, new things come into play. So the best thing that I may ask is for us maybe to just use to automate our processes and techniques in the way to foresee our landscape. Why am I saying this? I'm saying this because of recent days, we've been trying to manage how our technicians and how our workers are working. And we go before. All of a sudden, another issue was created. And how has it created? The gig working. Now does it come into play? Our contractors now have devised a method whereby they bring on board. Let me use street word, Kamagera like. How many people know Kamagera? People normally just feel Matako and then they're not. So what they're doing, they just take those people, they bring them in our high-risk environment, and then they pay them this work. So you can see that it's not in our radar, it's not in the radar option. So the best thing that we can do is for all of us as team to engage and to come up with analytics, good analytics that can predict how our future work is going to be. Then we use those models to to come up with structure and then continuous collaboration. I want to see DOSHS collaborating with people like us, bringing us to meetings like this. What do you see in this particular field? Where can we put more safety so that at the end of the day we can protect our people? And again, I like what DOSHS did some time back when you guys decided to go to what do you call this, salon, to train those people. It was a very good initiative that I said, wow, Safaricom is supposed to collaborate with this so that at the end of the day we can have insight from that big work and come up with measures that we can take. Safaricom can come with automation, we can come with tools that can help to predict and to give you insights. So I'm seeing a situation where it's just one side operation. Things are going to be messy. So we are supposed to be careful as we go in the future.
Thank you. Thank you so much. Prof, I just need you to argue the business case that really would support these gig workers and contractors for us to be able to enforce a healthy psychosocial well-being.
Yeah, thank you so much. And having listened to the previous presenters, being a business person, for example, and speaking for the business arena, I believe what we have spoken must be working towards improving productivity in the business sector. Everything that has to happen has to move towards, because that business person is looking at productivity, right? I want to take a product to the market. I want to be the best person who is supplying this and that. And how do I do that? I need a person or a people who are going to do this. So ideally, as we speak about this psychosocial, having listened to the presenters here, one of the things they have spoken about is collaboration. And the other thing they have spoken about are frameworks, and certainly the policy issues. There are certain things that I say, as a business, you can have the policies drawn very clearly. You have made sensitization, and your people know them very well. You may have the frameworks, and they also have, I mean, you have the organizational structures. But ideally, you must stand there for things to happen. So ideally, if we are collaborating, probably like, for example, Safaricom is putting it across, and we are saying, fine, I have been having these setbacks in my organization, and what I am not so privy to is what are these psychosocial issues that are affecting my people. And a lot of sensitization comes around on policy issues around, psychosocial. You are empowering my people, you are capacity building them, and when we feel we belong, and when my employees, for example, feel they belong, where their issues are well taken care of, because as an employer, I may be speaking where they think I'm speaking because I want them to produce for me. But in a space where they feel that what I say is ideally what is legalized, and that there is a framework somewhere that takes care of their issues, then I think coming down to my business, I believe that productivity will grow.
Great. Just before I get back the panelists again, I'm back to you, delegates. This is a discussion to all of us, and I need to get 3 or 4 of you to imagine a world where we have included these gig workers, these contractors workers, and briefly, 1 or 2 just tell us, what do you think would be the things or the kind of environment that is needed, which at the moment they are not enjoying? Back to delegates. Think about the gig worker. What do you think is the kind of environment, psychosocial environment that is missing, which is needed? Yeah, the mic is going. Anyone go to Gladys?
Okay, so good afternoon, everyone. I'm Gladys, and I just like to delve in the discussion that is ongoing. So there's someone in the morning who talked about the Maslow hierarchy of needs, and I always feel the gig workers or the casual workers need actually protection from the organization. Some of them are not at fault because they are forced
to actually do something that is unsafe because the basic needs have not been met. So you cannot argue or you cannot demand something from someone who doesn't even have money for food. Some of them go to work when they are hungry. So it's for the organization to protect them. So at the end of the day, if the organization has done its best, then we can move to the workers and ask ourselves why. But as long as the basic needs have not been met, then we are just fighting a losing battle, I can say. So organizations need to do more. And sorry, sorry, just a minute. Then on the issue of cost-benefit analysis, I think it's very important. I always hear of big queues when it comes to civil, electrical, but when it comes to safety, it's like this organization should be ready for putting all those systems in place. But remember, safety also has a cost. So if you are asking this organization or these contractors, some of them who are SMEs, to be able to meet those requirements, then the organization, the client needs to be very, very intentional when they are designing the projects and asking these requirements from the contractors. Thank you.
There is another need. Anyone who came with the Uber or taxi and the driver was like, imekupatia ngapi? Can we negotiate? Anyone? Ama niko Mombasa tunatoka. Thank you. Yeah, it's happening. Why? Because of what she's saying. Those platforms, they are like employers. Thank you so much for that contribution. Yeah.
Good evening all. My name is James Joroge. I work in a little bit different place. I work in Iraqi oil fields and rock oil. When I'm there, I'm a safety supervisor for maintenance activities that are carried on in the processing areas and also in the wells as well, oil wells. And about the contract, because we have contractors, I can assure you when it comes to safety, I never compromises anything, because if you promise anything, it's going to come back to you. And the way forward is how systems are set. If there is permit work systems, we obey permit work systems, and also method statements, which actually carries a very big weight when a contractor is concerned, because I also oversee the contractual part that my staffs are not involved in. I have a query here, and it goes back to the safety professionals who are here, or safety practitioners who are here. I have not heard since we started anything to do with us as OSH practitioners. We are also human beings, and we undergo what we call psychosocial hazard, and sometimes we are not even able to process because everybody is looking at us, and it becomes a problem. For example, I'm going to major into two things that we undergo through as OSH practitioners. One is vicarious trauma. Vicarious trauma. This results from the repeated exposure over time and other cumulative post-traumatic response, and is sometimes referred to as compassion fatigue. Compassion fatigue. That is what we undergo through when it comes to our daily events or duties that we are involved in. Then there is what we call secondary trauma. Secondary trauma can occur unexpectedly and suddenly as a result of emotional distress from indirect exposure to another person traumatic experience, how do you process that as a safety professional? You're going to go down if you are not. Safety is not for the, I can tell you, safety is not for the wicked. And in order for you to undergo and be strong, you must be and you must have passion when it comes to safety.
Thank you, Njoroge.
Just a comment. This secondary trauma, it is an acute response where symptoms often mimics post-response disorder. How are we going to be helped by the management in undergoing all those two things I have mentioned, traumatic, secondary trauma and vicarious trauma? Thank you.
Thank you so much, Njoroge. I know today we're not looking at DOSHS practitioners, but some of them, yes, they're actually consultants. But what you're talking about, I know the full-time employees, the safety employees, death has just occurred at workplace and everybody's looking at you. Why did it happen? And you told us with the risk assessment there'll be no death. And you're there to answer. Thank you. Add that comment before I get back to the panelists. Now I call to action on what we are supposed to do. Yes, so this is just a random. This is a random to you that I need to get one because it's on standard. Let's. You think there should be a psychosocial safety floor for all workers, that is at workplace, in terms of do you think it will help creating a psychosocial well-being floor within workplaces as part of improving a psychosocial well-being? Let's start here from Safaricom to government bodies to institution as a general question.
Yes, so actually we normally say try not to follow that guideline of wellness and you will see it. So it's up to us to make sure that we go back to the basics and put people focus around wellness to see change in how we run our product. Because as the business management is going currently, we are using people. Even if AI will come, we are using people. So we're supposed just to focus more on their wellness and to see a turnaround in the investment that we are putting across. Just the way Gladys has said, let us fix their needs and we're going to see change in the
Okay, thank you. Yes, Madam, from your workplace, do you think it would be important to have such a floor, such a forum?
It is actually very important. You can have the best systems in place, and with a person or with the human aspect that is not, let me say, the human aspect which is not well-being, then what you have put in place becomes zero. So human aspect, the well-being of human being, their social aspect, everything revolving man, human behavior, it's actually very essential in every workplace. So as a conclusion, I will say we really need to put a lot of stress on issues pertaining welfare of workers, even not only just workers, every person at workplace, so that we have a community that can be able to develop a strong working force that will ensure we have strong organizations in place.
Yes, Madam Professor, from institutional point of view, especially from education point of view, as a call to action, and realizing that this number of gig workers is indeed increasing. The Gen Z don't want full-time employment, they want just to work as they are. What do you think from institutional point, especially from educational curriculum, that needs to be done for us to be able to embrace psychosocial well-being of this group of people?
Okay, thank you very much. We are here because somebody realized it was important for us to speak about psychosocial issues and how they affect the employee and the workplace. If we can't speak about it, people won't realize it's important, and that they won't even realize that they are going through this. Sometimes you realize when you are talking about how you're feeling, and somebody tells you, oh, those are symptoms of this and that. Sometimes we may not know. And so the platforms that may be created at workplace are very key, especially so for sensitization and also for policy. I think it is very crucial. But I will also wish to add one statement. Notice, is it Kengen or geothermal? They say they have tried to make people talk, but not everybody is speaking. So again, we need to strata our employees at workplace so that we are saying we are speaking to this cadre of people, then we go and speak to this. But when we blanket them, even much as we want to do sensitization, it may still repercussion on us.
Thank you so much. Dr. Muruga, from policy framework, what do you think is the action that needs to be done, either at directorate level or parliamentary level, for us to be able to manage these workers?
Thank you very much for this particular question. I think before we go to national level or whichever level that we want to go to, we must start the process at the individual level. You see right now we ask people to go for, the laws require that, you undergo an annual medical examination. And if you look at the general framework of that annual general examination, it looks at the body. But with respect to psychosocial risks, we have both the body and the mind. So we need to find a way by which we can incorporate into the medical examination framework specific provisions for assessing the mind and coming up with psychosocial risk profile for every individual. So that should be able to be incorporated in the medical examination rules, if they will be made then, and also be put as part and parcel of the occupational safety and health bill, which is 2024. I think partly it has been put there, although the law has not been enacted. But we need to expand the issue of psychosocial risk because a safe person drives productivity. But somebody undergoing psychosocial exposure is unable to drive productivity to the level that is required. Secondly, we have to bring in these professionals that are in, sometimes they are around here, sometimes they are not here. Professionals like psychologists, psychiatrists, their input is urgently required into a new framework to develop what we call the National Registry for Occupational Injury related to psychosocial risks. We know that psychosocial risks are if the nexus between the risk and the workplace can be proven, and therefore we need expertise to be developed to be able to address the specific psychosocial issues affecting individuals. At the workplace level, if our workplace is small, the CEO is the accountant. There are one or two people. The CEO is the accountant. The CEO is everything. But as the workplace grows, you will start hearing positions like HR managers, sales and health managers, and all that. From the data that is available, psychosocial risks are a total menace in this country. They are serious issues, and therefore workplaces must be able to recruit people who are qualified to address both the body and the mind. The machines that had sharp edges that could injure people are still there, but now the focus is turning towards fear at the workplace. There is fear about the job due to job insecurity. There are fears related to retrenchment. There are fears related to, so many things at the workplace. So based on all this, workplaces at the workplace level should be legislated to actually have people who are qualified and competent to deliver on psychosocial risks, because that's where the problem is. Then the people who are psychologically and socially stable will be able to drive economic development in this country. Right. So we need to revise the Work Injury Benefits Act to reflect on the compensability of defects and be clear, explicit, rather than just mentioning that they are compensable. There should be clear provisions and very explicit on how these psychosocial risks can be assessed, evaluated, and determined. And of course, how somebody who has suffered from psychological risks can be assessed for work injury compensation. These are important. But now, before I forget, I think Safaricom has said something very important in terms of how Safaricom can adopt some workplaces, build their capacity, and also ensure that they are able to be aligned with psychosocial risk management principles. So I think Dr. Midanga has had this. These are some of the opportunities that Safaricom we can work with and the directorate to ensure that things are realized in the workplace level, and particularly micro, small, and medium enterprises, where the greatest problems are due volatility of incomes and related things, job insecurity, lack of control of jobs, and so on and so forth.
Thank you so much.
Thank you.
Thank you so much. Just before we summarize, just as a parting shot, thank you so much, our panelists. But if Dr. Muruka would have further gone to break the statistic that he showed here, where 96 men have died the last 2 years, and if you would further gone to break whether they were contractor employees or they were full-time employees of a particular company, then you realize within the very, very organization, the control workers are the most prone. And as the panelists have said, the call to action is inclusivity is very important. If it's awareness, if you are doing training, stress management, include those contractors within your workplaces. If you can get time to talk to that taxi driver or whoever, talk to them, create awareness. It starts with me, and so it is safe with us. Thank you, my panelists. Nice day.
Thank you.
Let's clap for them, please. That was so good. That was very good, insightful, educative. We really appreciate that. I think we've come to the end of that session, and I am informed, as we earlier agreed, the meals are ready. But I want to request you one thing. The afternoon session, you said it will be very brief because we have a live TV coverage that will happen here, and we need to prepare the room. So I want us to take maximum 1 hour for lunch, maximum. So we had set it at 30 minutes, but because the group is huge, but we have been told 3 serving points have been set aside, so it will be easier. I want to request the people at the front, the first 2 rows, the NACOSH, the leadership, please you can exit for Mr. Odimo. Mr. Odimo and Madam Irene will be showing you where you can go. All the presenters, if you've presented, please I want to give you an opportunity to leave first, so that after the first 2 rows have left, we will have the others exit using this door, and those that are behind, you exit using the other door. You will be given a name card as you exit. But please allow me to just evacuate the first 2 rows. So please, members of NACOSH, leadership, if you are ahead of a delegation, please follow this team. If you are head of a delegation, I want you to follow this team so that it can be easy. So enjoy your meals. See you in the afternoon. And we have the QR code for the conference materials. All the presentations, you can scan the QR code. All the presentations.
So that we can actually come up with strategies of reducing accidents. And one such event like this is the one we come and interact with stakeholders so that we can be able to share our experiences on how we can actually be able to reduce electrical accidents. If we can put the next one. Yeah, so in terms of numbers, as you can see from 2021 financial year up to last year, 2024-2025, you can see the numbers. If you look at the fatalities, although in 2020, 2021 was the highest so far, 118, 2021, 2022, you can see the upward trend from 65 all the way to 93. So on average, you can say we are losing about roughly 100 people, because these are only reported, but the others that are not reported, particularly when you go to those slums, you know, where people do legal connections. When somebody dies, they don't report because they know if they report, they will be arrested. So they quietly bury their people and move on. So the real numbers are actually higher than this, slightly higher. But these are the ones that have been reported to both KPLC and EFRA. So those who are, they are human and also animal. But you see, animals, yes, we don't say it is good for animals to die by electrocution. It's only allowed for animals to die by the sword. Because even this afternoon, you have feasted on some animals that were killed not by electrocution, but by slaughter.
Okay, next. I think these are the same numbers in practical form. We'll go to the next. In terms of root causes, when you look at the biggest cause of electrical accidents is actually defective of fallen power lines at almost 24%, followed by poor or substandard wiring of poor safety culture. So I think one of the ways we have also been trying to do in the sector is actually to promote the culture of safety. Although our focus is actually the field staff, but this safety culture should also begin from the office, because it is the office people who actually guide the people who are doing the work in the field. When you are a manager, most of the times you are in the office, but you have to guide the people who are working there. So we are really trying to work on safety culture and also poor customer installations. I think it's also round number 4. So generally those are the core. As we do our analysis, this has been the trend generally. Sometimes maybe number 1 and number 2 can swap, but that has been the order. So when we do our mitigations, we do mitigations that are geared towards specific root causes. Okay, next. These are samples of incidents. For example, this one here, this is a power line passing closer to construction site. There are several accidents we have encountered under such circumstances. Like I remember, there is one structure from Kitale. We went there almost 5 years ago to investigate an accident because 2 people died under similar circumstances. They were doing construction. Up to today, that building is still standing. The owner will not want to move it. The power cannot demolish it. Nobody is talking about it. It's just there. So we don't know whether it will stay there until Jesus comes back. This other one is fallen power line. We have had people electrocuted because of fallen power lines. No, you can be somebody just passing along the road innocently. There's people who don't know that maybe a cable or a conductor may be carrying power. They may go and either touch it intentionally or unintentionally. Then they get electrocuted. So, like I remember there was one incident, I think it was in the night. Somebody was coming from, bringing joints. So they're not seeing the road well, but the cables are on the road. This guy was electrocuted. Okay, he didn't die, but we went and visited him. It was so sad. The guy could not walk. And he was a guy who was doing his work. And he actually became disabled. I think it was even highlighted on TV. Next. These are a few samples. Well, that may look a bit dramatic, but I think you also saw it on Facebook or TV. This is a guy in Kisia who was trying to steal electricity. I always say, somebody who steals a transformer at night can be a very good contractor during the day. Because if you can work in the dark, in the daytime you can be a very good person. These are some of the installations in our houses. You can see somebody is connecting the shower directly from the socket. So those are just some of the sample incidents. There are many. Next. In terms of trends in per county, as you can see, Nairobi is leading. Why Nairobi? Because Nairobi has got a high population. Currently, Nairobi, you have how many million? 6. And also there are many slums, and you see in slums where we have a problem with the safety of electricity, followed by Machakos, Kisi, and Bigol. We have done analysis and discovered that illegal connections are done mostly in South Nyanza. The region that is leading in illegal connections. Kisi, Gori. See, that's why they're also leading in electrocution. If you steal electricity, it can kill you. But if you use it legally and also use it wrongly, it can kill you. The issue is to be safe. This county, I think we are number 7. We are doing, that's not good. Thank you. I've finished actually. So this county, you are leading in athletics. But when it comes to electrocution, you are, thank God you are number 2, not number 1. Then the next. So these are some of the safety measures we are trying to put in place: regulatory enforcement, we enforce standards, we do safety audits, and public awareness campaigns. Kama hii car safe, umesikia car safe plan? Sorry, have you heard about it? Car safe plan. Hata mimi niko na t-shirt hapa ndani ya car safe plan. So when I'm wearing it, I'm safe. Next. Next. Those are some of the recommendations. Those who are road contractors, we blacklist them. We enhance awareness in forums where we have practitioners, and also improving our standards in terms of using, let's say, gas insulated switch gears and so forth. Naongea mambo ya gas mtaani na ngao. Ya mwisho, that's a quote. Most electrical accidents are not acts of fate. They are the result of ignored standards, shortcuts, and assumptions. Thank you.
Thank you very much, Engineer. A big hand for Engineer. Thank you. Now we move to another segment. We want to, because of time, we want to shorten the session. We want to have only 3 reflections or reactions, and then we close and go to the awards for presenters. We are going to allow only 3. The rest we are going to use technology. We will communicate with our officer. We can give our reactions, our questions, and so on, so that they can be addressed in the course of time. Thank you very much. So maybe, how are we going to do it? Maybe one from this area, another one from here, Katikati, and then lastly from this row. So let's have some reflections, reactions from any of our participants. From this area, yes. Anybody? I know we are thinking about it. Anybody? Okay, I'll come back to you. You can come here. Yes, you can maybe come here in front. Thank you. You will say your name and then proceed.
So good afternoon once again. My name is Gladys. So for me, what I'd like to reflect is that the conference has been much better than last year. So to the organizers, thank you very much. Last year the turn-up was a bit low, but I'm hoping even next year will be better. So when it comes to my reflection on the conference, on the discussion of the psychosocial, I don't know how many HR people are here, maybe by a show of hands. Okay, so we only urge people. So actually that was my concern as I sat there and listened. I think the discussion should go to or be extended to the HR people, because at the end of the day, these are people who interact so much, especially when it comes to the well-being of workers in our organization. Yeah, so that is my reflection, but the conference is very good. Thank you so much. I'm Gladys Nyaga.
Big hand for Gladys. Thank you very much. From this row, who raised first? It's you.
Thank you very much. My name is Gilbert Ariaka, and I'm the organizing secretary of WASPAC Workplace Safety Professional Association of Kenya. My reflections today is as a safety person. Am I the person causing the social problems to start at workplace? Being a leader, we realize the problem. We talk about a lot about psychosocial issues, but at the end of the day, you realize we are the people who have powers at workplaces, and we tend to leave people stressed. So what are we going home with here? We need to be the solutions, because we tend to be the people driving the psychosocial anxiety. So one of the things I wanted to say is, as a leader in WASPAC, I can see that the kind of people I'm leading, sometimes they give you problems with WhatsApp group. Somebody can wake up from anywhere, write something, when you question, they feel like they're entitled to ask you questions or not to be deleted. So and therefore we become problems. So I'm requesting as we move from this place, we need the solutions, not part of the problem. Because we might be talking about the social singing to people, but in this sense we are not talking about ourselves. It's like the preachers who preach to people, but they don't preach to themselves, they don't listen to themselves. And therefore we request as we get out of this place, my reflection is, let us internalize what we learn and let us practice. Thank you.
I think the hand for it. Let's be solutions to ourselves, to our problems, ourselves. This room. Yes, please come in front. You'll tell us your name, and then something that you picked from this conference. Thank you.
Good afternoon. My name is Simon Oteba, and so I'm here, really impressed with the attendance. And just give yourself one clap. Just being here and discussing mental health. So I believe during the session, most of the presenters here were giving us a call to action to influence our policy. I don't just by show of hands, how many of us here have ever participated in a policy review, whether at organization level, national level, or international level? Okay, quite a good number. Second question, how many of those policies that you probably reviewed or drafted have a clause on psychosocial well-being? A show of hands. Your policy in your workplace has a clause on psychosocial well-being. Okay, the numbers of the hands definitely reduced. Is that true? Yes. So the question is, what action are we going to take after we leave this place in terms of influencing the policies within our organization or wherever we work, to be able to have to make this psychosocial hazard visible? Okay? You people are the real change makers. When you go back to the organization or the workplace, you're the people who are going out of top management and inform those policies so that we make this social hazard visible and partner with the people in culture, the HR people, okay, so that we're able to take care of the well-being of our people at the workplace. So very simple call to action. As you do your next policy reviews, let us start at the policy level. And then now we implement this policy, we go to our people. So thank you so much. I look forward to the next engagement.
Big hand for you. Thank you. Now we want to move to the next session, and this one is awards. But before that, I wish to acknowledge the AG Director, Electricity Renewable Energy. Maybe you can stand and wave to the
audience. You're around, maybe it's outside. I wish also to recognize Boniface Kenyanjui, Engineer Boniface Kenyanjui. Please stand up and wave to the audience. Kenyanjui. Oh, maybe it's out there. So we can move on to the next session, and this one is the awards for presenters. I wish to invite Florence Nang to come over here with certificates. I wish also to invite our Secretary DOSHS, Dr. Musa Nyandusi, kindly come to the front. Florence, please. So we are going to have awards to our presenters. They have done a great job. Florence, please.
Thank you, Justice. The Secretary, NACOSH members, ILO representative, our directors, DOSHS professionals, my colleagues, our esteemed guests, good afternoon. We are coming to the end of our exciting workshop, and I'm glad to say that we had a very good interaction, and we had presentations, and we had a panel that was silently reviewing and picking for us a winner. But because we are all winners and we have participated, we want to thank our presenters by awarding them a certificate of participation. We recognize the efforts that they have made in sitting down and preparing these papers for us and enabling the discussion on psychosocial hazards in the workplace. So before I call the Secretary, I would like the presenters to come forward, and we are going to give you certificates of participation. And then I'm going to highlight how we came up with the winners. We were able to look at 10 parameters, and there's an independent team of 3 that has been in the process from the very beginning, that is reviewing the abstract, shortlisting, and assigning you either a poster presentation or as a main presenter. So I want to begin with Mike Chege and James Itonga, and they come forward and receive your certificates. Let's welcome them with a clap. We would also like to call our own Dr. Melanie Murgo. Karibu daktari. Dr. Melanie was able to talk to us about burnout balance and the state of civil service. And I think you heard that 48% of us are depressed. Do we look depressed? I think I'm among the 52%. Daktari, karibu. Thank you very much, Daktari. I don't want to be biased, but I'm also calling an of our own. Esther Motuko. Madam Esther is a new officer. She has been barely with us for 2 years, and she is in Nyeri County, and she was able to cause us to see the issue of psychosocial is being hurt. Najua tunatuonanga tu kwa construction sites, tukiuliza kama tuko na helmets. Esther, thank you. A clap for Esther. Thank you very much. I would also like to welcome Engineer Godfrey Osundwa. Na hajakuja na support yake. I think he was able to bring to psychosocial issues in the energy sector. Thank you very much, Godfrey. We also want to call Engineer Agnes Mainya. A clap for her. I think our conference was very heavy in the energy sector. Thank you, Engineer. Another clap for her. I also want to call another engineer, Engineer Tom Silio, our last presenter. I also want to highlight the presentations done by our very own Dr. Andrew Muruka. Daktari, karibu tukusalimie. Welcome, our director. The most complex presentation of the day, but we understood something. Tunamwambia certificate yake ni tofauti. Tutapeana nyuma ya tent. We also want to welcome Professor Fanny Swangila. I believe that was the only professor of the day. Makofi kwe kubwa. Professor Fanny, tutakuona nyuma ya tent pia. In camera. Thank you very much. And now to what we've been waiting for. The best presenter. Engineer Mariaka, tulete hiyo trophy tuione. Even as we want to give this award to the winning presenter, I want to highlight that there was a team that was analyzing the presentations, and we were able to review the presentations in 10 areas. Number 1 was relevance to DOSHS. Maximum marks were 10. Number 2, originality and innovation. We were looking for a novelty of ideas, creativity, and uniqueness, and the maximum marks were 10. Then number 3, we were looking at the scientific and technical quality. We were looking for sound methodology, data analysis, and accuracy, with a maximum of 15 points. Then we had clarity of objectives, clear problem statement and study objectives, with a maximum of 10 marks. We looked at content organization for logical flow and structure of the presentation, 10 marks. Then presentation skills, we looked at communication, confidence, engagement, and delivery, 15 marks. We looked at the visual aids, the posters, and the quality of the presentation. This is the quality of the slides, the poster, readability, and design, 10 marks. Then we had practical application, relevance and applicability to workplace DOSHS improvements, 10 marks. Then we looked at time management, adherence to allocated time, 5 marks, and response to questions. Then we had the ability to answer questions clearly. This one, I think we didn't allow too many questions. We didn't allow questions, so we didn't score you on that. So out of this, we were able to get a clear winner. Na nimepewa bahasha. And I want to present Bwana Mariaka. Kindly lift so that they can see what the award the best presenter will be getting. So we want you to remember that you came, you saw, and you conquered. And our winner for this afternoon is Engineer Godfrey Osura. From the applause, I think the committee also deserves a clap. I think thank you very much for showing us that engineers can be excited. Thank you, Bwana Secretary. I think I want to return this to Bwana Justus for closing and way forward.
Thank you, Florence. Thank you, sir. Please, you can take your seat. Big round for Florence and our coach. You can give a better clap. Thank you. Thank you. Now we are on our way forward and recommendations. We have provided a QR code where you can give your feedback, and that will provide a way forward for this conference. Please cast it on the projected here so that people can see from the back. So we will expect that we have your feedback so that we can have a way forward for this conference. Disappear. There is no path. Yeah, so we have a QR code which we can provide a feedback on the same, and this will provide the conference recommendations. So we have come to the end of our conference today, and I wish to thank, starting with the hotel management, all the presenters who have come and done their presentations here. It was wonderful. We have learned a lot. All the officers from DOSHS, all our partners, sponsors, and of course, all those who have made this possible, plus the committees who are involved. Now I want to finally invite once again our Secretary Osh to wrap up this session with an official closing ceremony, remarks, and then thereafter we shall have a national anthem. DJ, I hope you will hold the national anthem standby. As soon as the speech is over, then you shall play the national anthem, and then we shall have a short prayer, and then end this conference. Thank you. Karibu. A big clap for our secretary. Thank you.
Thank you, Justus. Wow, what a day, eh? What a day. I would like to sincerely thank each and every one of you for having taken time to attend this conference and participate in this conference. This conference has been, we were sharing with Mr. Nyongesa, who is one of our former officers, who looks younger now since he retired. And I was wondering whether there were the psychosocial hazards in DOSHS when he was the head of field operations. But you're sharing with Mr. Nyongesa, and we were recalling where the conference started. And we remember that the first conference we barely had about 5 or 7 people, and we still called it a national conference. So if you look from where it came up to where it is, I think we can actually talk about a legacy of continuous improvement, for which I would sincerely like to thank the organizers. Secondly, I would like to recognize the leadership of WASPA. And I would like to give them a hand. This is the first time. Each time we have talked about having an actual national conference where we bring both government and professional societies in OSH in one meeting. And I'm glad not only were you involved in the organization, you are also actually involved in the setting out of the conference. And I can only look forward to bigger and better cooperations, and I would like to say thank you. Next year, I am looking forward to something even bigger. When we were planning this conference, I think we did have an idea that it's a conference that has a lot of interest from many players. And I am challenged that in the next year, it is possible that we can actually have a 2-day conference. I'm speaking to the people who have aspirations. And I am also hopeful that we can have the various professional, specialized disciplines of OSH specifically be very visible during the conference. So that I would want to see something. Even if you're talking about psychosocial, next year, I'm sure ILO will give us another thing. But next year, I look forward to seeing a hygiene perspective on the psychosocial aspect. When we were enacting our new officers, and when we were going through the Occupational Safety and Health Act, and one of the new officers happened to be an officer who had served as a medical officer in the counties. And he had an interesting question when he asked, so is there anything in safety and health for someone who works for a county government for 6 months and doesn't get paid? There are many aspects that are there to them. I also remember personally as an intern, I did my internship when we had a real problem of AIDS. For those who remember the late 90s, early 2000s. And I was in the medical ward, and I admitted 91 patients in one night. At about 3 a.m., I was called by the nurse. The issue was that I needed to certify 31 of them had died. I'm guessing that the same thing may not be happening in the same scale, but the issues of psychosocial health become equally as imminent in the workplace as it was then. Between the reflection, which I hope we are going to continue having, and a conversation that we are only triggering in this conference, what we are the mind, so that we can now begin thinking about what proactive processes one can actually take place to be able to deal with the issues that are. We have had many instances in the Ministerial Human Resource Committee where we have heavy amount of alcohol and drug abuse. And I think it is not a ministerial problem, it's a societal problem. Heralded by anything other than psychosocial hazard. And what is the impact of these challenges that our officers are facing to the safety of their delivery of their responsibilities? I would like to for the persons who are in the energy sector, and I'm sure the issue of alcohol and drug abuse, just like it is in so many safety-sensitive professions, these are the conversations that we must have, and we really do not have a choice but to have. So I'm happy, and I would sincerely like to thank everybody who has come to initiate this conversation. So this is the initiation of a conversation. The interventions, we're going to consciously be able to propose interventions that are practical and aligned with what the ILO have asked us to think about, which coincidentally happened to be what the department had been thinking about when we started practice on psychosocial health in the workplace. I think we are challenged as a generation, and it looks like ultimately it seems like it's a global issue. So let's hold hands, continue these conversations in our various enterprises, and let us hear the unique interventions that we are going to come up with in our workplaces for us to be able to realize the kind of workplaces that are productive and safe for our workers. With those few words, allow me to bring the curtains to close and declare this conference official.
We will all rise for the national anthem. DJ. Thank you. We remain upstanding for a word of prayer.
Hello. Before we pray, allow me to thank you as the Chairman World Day for Safety 2026, and welcome all of you. As you came today, you double even the numbers tomorrow for the celebrations that will be held at Central Primary School. Welcome.
Agnes, please come to the front so that you pray for us. Agnes. Kindly, thank you.
Okay, let's pray. Father, in the name of Jesus, we come before you this evening, Lord, with thanksgiving in our hearts. We have come to the end of our conference, and Lord, we've learned a lot regarding psychosocial issues for the worker, Lord, and even beyond. Lord, we have taken a lot of lessons from this conference, and Lord, we want to ask you that even as we go back to our workplaces, as we go back to organizations, may these lessons be impactful in our everyday work and experiences, Lord. Lord, even for the management that organized for this conference, I want to pray that, Lord, you're going to continue blessing them so that even they will be able to organize even better conferences in the future, and that, Lord, safety will grow in Kenya and even beyond. That, Lord, we will not even have more deaths, we will not have more injuries at our workplaces. Even the unseen injuries like psychosocial issues, we will not have them, and Lord, we will even learn to manage them better. As we're going to depart this evening,
as we're going to go to our places of stay, and even those who are going to travel, we want to pray that you're going to give us protection, you're going to give us journey mercies, and even as we plan to meet tomorrow for the celebration of the World Safety Day, and Lord, you're going to also oversee those activities that are still going to be done tomorrow. I want to pray that even as you come to the end of this conference, may it not be the end of learning, but Lord, may you continue to do more and more good for the good, for your good, Lord. I want to pray for each and every member, our families who are not here. May you bless them wherever they are. May you protect them wherever they are. I pray this, believe and trust in Jesus' name. Amen.
Thank you very much. We can now leave at our pleasure. But should you wish to remain behind for the live broadcast on NTV, please do so. And it is mandatory that the panelists remain around, don't go far. We are starting as from 6 o'clock. 6 o'clock we will start the live broadcast on NTV. Our panelists will be Dr. Mohsen Yanusi, Secretary DOSHS, Mr. Anthony Onaina, his NACOS representative, Madam Irene Raja, Director DOSHS,